Sawyer's already made up his mind. He's just got to
Well,
make sure that he follows through. He wants to
You
go to
can't hide behind that computer screen all the time.
football at Jenkins. So he better eat his Wheaties.
Especially when you're asking for bucks.
Jesuit was my preference for Noah because all those kids started together. I liked that idea.
You got to do a little bit of homage.
She got into both, and we said, if you get into both, we can afford it. Like, we'll let you choose. Like, so there's like acceptance.
It's important. You know that.
Then it's your choice because it's
St.
high
Mark's
school.
and of course Superior regarding
How you doing?
academics.
I'm trying to think of what's going on. That's
I mean, it is.
There's what?
The thing of like, see, those
Oh, well,
good.
good. Yeah.
You know, it's
Yeah, Martha's really good to me.
kind of overcome that.
She brings me coffee. Thank you, Martha.
Pivotal here because some of those boys are friends.
Yeah.
That's why I like Jesuits. Everybody's coming to new together, so you don't have to quit.
Yeah.
Other stuff. It wouldn't have bothered Noah. I'm hoping this is a turnaround.
I'm looking forward to the TAC
for
meeting
making friends because
in 2 weeks. Yeah.
I mean, it makes the same
Well,
market
they always
that
do.
much work. So my son loves Duke, who always picks Duke in the Final Four. The second semester, I started out really
Absolutely.
with his friends in other schools, like
Which reminds me, I would like to see if I can set up meetings. I would like to talk with Royce West, if at all possible. The last time I saw him. If you need anything, let me know.
There we go. Yeah, apparently the audio is back on, so we can be back on. I believe our next resolution is Commissioner Garcia.
No, it's Commissioner Daniel.
Commissioner Daniel, okay.
Yeah, good morning. Why don't we move to a commitment to women's health care, which is a topic very much in the news, and I am not sure whether there was anybody who was able to make it today, but let us go through this. Whereas Dallas County honors the right of pregnant persons to bodily autonomy and control over their private medical decisions and the protection of the patient-doctor relationship. And whereas access to safe and legal reproductive health care in various forms is a major factor in the long-term health, safety, and equality of life of pregnant people. And whereas on June 16, 2021, Texas Governor Greg Abbott signed into law HB 1280, which criminalizes certain reproductive health care options at the level of a first-degree felony, carrying a sentence of up to 99 years in prison with no exceptions for rape and incest, which act will take effect statewide 30 days after Roe v. Wade is overturned. And whereas the Supreme Court of the United States has overturned the landmark ruling Roe v. Wade, which previously prevented individual states from directly banning such care. And whereas on July 8, 2022, President Joe Biden signed an executive order on protecting access to reproductive health care services. And whereas in the 1973 Roe v. Wade majority opinion, Supreme Court Justice Harry Blackmun stated, "The right of privacy, whether it is founded in the 14th Amendment's concept of personal liberty and restrictions upon state action, as we feel it is, or as the district court determined in the 9th Amendment's reservation of rights to the people, is broad enough to encompass a woman's decision whether or not to terminate her pregnancy. And whereas the right to privacy should protect doctors, patients, and all others involved in care from any criminal investigation, as long as those decisions occur without coercion, force, or negligence. And whereas according to the American Journal of Obstetrics and Gynecology, July 2022, the potential health risk and impact of eliminating legal access to certain reproductive health care options has been empirically proven to dramatically decrease the risk of death, bodily injury, and infertility, while doing little to reduce the incidence of abortion. Using Parkland Hospital data, the study showed maternal morbidity occurred in 12 of the 28 patients, at 43%, and 9 of them required intensive care admission. The article leaves us with the question of, what does the threat of death have to be for privacy between patient and medical provider to be protected? And whereas the county has a responsibility to protect its residents from any violation of their human rights and of any prosecution for the free exercise thereof. Now therefore be it resolved that Dallas County is committed to women's health care and is dedicated to protecting bodily autonomy as a basic human right. Dallas County must always be devoted to the health, safety, and well-being of all of its residents, including pregnant persons, who should have control over their private medical decisions and have their patient-doctor relationship protected. And I so move.
And I second.
Can I ask a question of the language? I mean, I know abortion's only mentioned once, right? So are we, when we're talking about supporting the Roe v. Wade standard, are we saying that, we support an absolute right to privacy throughout the entire pregnancy, and as it was understood in Roe before Planned Parenthood versus Casey, that absolute right to privacy essentially allowed for abortions in the 8th month or up until the moment that the child was born. So are we using the Roe standard here in that regard, or are we kind of going back to the Casey versus Planned Parenthood, where we basically allowed the state to intervene in conflict with that privacy right when the child was viable?
I appreciate your question. I am not an attorney, therefore I'm not going to opine in that area at all, recognizing too that those are questions that are going to be addressed in the courts. What I am intending to do here, and what I think is Dallas County as our public health responsibility, is to be aware of the impact of what this has on women's health care, on their, as being shown right now, that when you add these extra criteria, that the impact on their lives, on their children's lives, is something that as a county with public health responsibilities, I think we must pay attention to.
Yeah, no, and that's why I want to make sure that I ask the questions and be supportive where I can be. So do you understand that privacy right, as kind of, you wrote this, does that mean, hey, we are going to be supportive of abortion at 8 months?
If I could interject there, Roe does not give a woman a right to have an abortion 8 months over the...
No. The Roe holding did. Casey versus Planned Parenthood basically created the...
if you read the Roe holding, it talks about, trimesters. And so I don't want to get too much into a legal argument, but I think you're misstating that the holding in Roe did not allow the individual to trump the state in the 3rd trimester.
That's Casey versus Planned Parenthood.
Well, then why don't we suspend this part of the conversation and look at what Dallas County can do with its public health responsibilities? And that's exactly what my parameters would be on here, and I have a sneaking suspicion that our good legal representation over here would be in accordance with that.
Yeah, well, so, I want to be clear, because I don't want to say no to this if this is something that I can support. I mean, I can support making sure that our employees and citizens of Dallas, when a woman's life is at stake, right? When a pregnancy is a result of rape or incest, when, you have severe disabilities that are incompatible with life, I will get in a car and drive that person to Kansas right now, today, right? But if we're talking about, hey, we're using vague language in order to support the position that, we're going to allow late-term abortions, which most Americans and most societies believe is barbaric, I can't in good conscience go along with that. But if we're saying, hey, listen, you know, the state of Texas has gone too far. State of Texas has gone too far. I mean, we're in a bad place right now. I agree with that, but
Okay.
I want to find out where we can agree, because I would like for us to have a concise statement, because it matters to a whole lot of folks right now.
Well, I think reading the language that is included here, that the focus is squarely on the public health responsibilities that we have. And further than that, I think that you're going to have to.
And I think, Commissioner Koch, if what you're just saying and put into the record, you know, is what you feel, you could support this resolution. There's absolutely nothing legal on it.
I don't know about that though, because
You
this
can definitely
appears,
vote with us.
this appears to support late-term abortion, and that's just not something I'm comfortable with.
I don't think
think
anywhere
that's what this
it's mentioned late-term abortion as something that probably most people will not.
Actually, it's square in the middle of the protection of the patient-doctor relationship, because that is what's one of the items that's being severed.
It's okay. I appreciate all the debate. Call the question, Judge.
Question's been called. Any further comments? Hearing none. All those in favor, signify by saying aye.
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 Any opposed?
No.
Okay, any abstentions? Motion carries 4-1, with the Commissioner KOCH in, as a no vote, and everyone else is a yay vote. I have the next resolution. I'm gonna
I've
pull.
got one more.
Oh, I
Yeah.
beg your pardon. Go
Yeah,
ahead.
sorry. This is a resolution regarding National Women's Equality Day, which Dallas County has observed for a number of years. And I will be carrying this to those areas, those organizations that will be having public recognitions of. The Dallas County Commissioners Court joins the nation and the community in recognizing Women's Equality Day 2022. On August 26, 1920, U.S. Secretary of State Bainbridge Colby signed a proclamation to certify the ratification of the 19th Amendment that prohibited denying any citizen the right to vote based on gender. Texas was the 9th state of the Union to ratify the 19th Amendment. And whereas the women of diverse backgrounds continue to arduously fight to ensure that women's voices are heard, even today, more than 100 years since the anniversary of Women's Equality Day, women of the United States continue to be treated as second-class citizens and have not been entitled to full rights and privileges, public or private, legal or institutional, which are available to male citizens of the United States. And whereas women could run for office before they could vote, so that today voters continue to elect women to represent them in significant governmental decision-making and support them in having a seat at the table. In Dallas County, 2 women currently serve as county commissioners, 40% of the 5 members. 5 women serve on the Dallas City Council, only 36% of the 14 council members, and in the Garland City Council, only 22%, 2 of 9 seats are filled by women. On the other hand, women represent 85% of the Balch Springs City Council, with 5 of the 7 members being female. And whereas the 2022 International Women's Day theme is #BreakTheBias, the Break the Bias campaign calls upon communities across the world to call out acts of bias against women. Acts of bias against women continue in the community, in the workplace, the home, and in school. Women's rights are challenged every day. As long as acts of bias and violence continue towards women, we're not done yet. Now, therefore, be it resolved that the Dallas County Commissioners Court does thereby proclaim August 26, 2022 as Women's Equality Day in Dallas County. Dallas County joins the nation in celebrating women everywhere: mothers, daughters, spouses, sisters, friends, essential workers. We call on the entire community to join women in support of women's rights. And I so move.
And I second.
All those,
And this one I can support, because it is important that we recognize Women's Equality Day, but I do want to note that I don't support the statement that women in the United States continue to be treated as second-class citizens. I think that's an overstatement. I think there are pockets of that, but when it comes to the institutions, our federal government, this Dallas County government, I don't think it's a fair statement. So I do believe in supporting Women's Equality Day, but I don't believe that statement is fair.
Well, I respect that, but I am.
Justice for one is justice for all, Commissioner Koch. I mean, there's no in-between or gray. I
Yeah.
will support this resolution. Thank you.
Reasonable minds can differ, but I think if men could get pregnant, there'd probably be abortions at drive-through windows. So I'm not sure that I would agree with you on
I'm
that,
not sure I
Commissioner
go
Koch.
that far. But, I certainly, as a woman,
let's just
know
vote.
that sexism is alive and
This
well.
is just getting.
All right, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carried unanimously.
Oh,
I've got the last resolution, and I'm gonna be pulling that at this time at the request of SMU and put it back on there wherever they want it.
It's 9:30.
Yeah, it's
9:30, Judge.
9:30, and we have a public hearing posted for 9:30. And so we're gonna open that hearing, and then we'll deal with, spin the rules and deal with some bond stuff. Is there a motion to open the public hearing on the Dallas County proposed 2022-23 action plan and substantial amendment to prior back year activities for the use of the Community Development Block Grant and Home Investment Partnership Program funds?
So moved.
Is there a
Second.
All those in favor signify by saying aye.
Aye.
All right, any opposed? Motion carries unanimously. We'll now have a discussion and public comment.
Mr. Tamayo.
Yeah, come on up.
Good morning. Thank you, Judge, Commissioners. This is the second public hearing for input on the federally funded Community Development Block Grant Program and Home Program for any comments, and as you noted, for fiscal year 22-23. And if there are any comments.
Well, lay it out, Mr.
Yeah, just gotta say enough
Just
to where we
lay it
got.
out.
Elaborate.
Yeah, lay it out as succinctly, yeah,
Yes, sir.
please.
Each of our 6 cities will receive funding based on our formula consistent with our policy, and we're expecting to hear if there's any public comment on the allocation and the way the money is being spent on those cities and those projects.
And there's some cities on this cycle and other cities in another cycle. Can you, put in the record where are the cities that this community grant money goes to?
Yes, ma'am. HUD regulations require that 15% of of an entity's home funds be awarded for special housing CHOTO projects. And so 15%, about 122,000 of the county's home allocation is being set aside for such purposes. Additionally, the county's replacement housing program is $618,000 and $77,692 for home administration. The cities will be using the funds for facilitation of orderly growth, facilitation of low-income home ownership, improvement and maintenance of low-income neighborhoods, and the elimination of community-threatening conditions such as blight, and finally, improvement of the local economic base. And I don't have, well, hold on. The cities receiving funding are Balch Springs, Cedar Hill, Duncanville, Farmers Branch, Lancaster, and Wilmer.
That's correct.
And those are cities with populations less than 50,000?
Correct.
Yes, ma'am.
Thank you.
Thank you.
I think we know it.
Are there any public speakers? Are there any public speakers? And then, this is just on the matter of the Community Development Block Grant and Home Investment Partnership Program funds. Are there any public speakers? Hearing none, I'll take a motion to close the public hearing.
So moved.
Second.
All those in favor signify by saying aye.
Aye.
Motion carries unanimously. Next, we'll take a motion to suspend the rules to.
So moved.
Second.
All those in favor signify by saying aye.
Aye.
All right. We have before us a lot of people waiting in the audience, who are various bond counsels, and people involved in the potential sale of bonds today. So, if we could, I'd like to take up item 52, 63, 64, 65, 66, and 67. Is there a motion on that?
So moved.
Second.
All right, is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye, any opposed? Those motions carry unanimously. That motion and those orders pass unanimously. This takes us back to our agenda and back to our presentations, our first presentation.
No. I have one last resolution that
sorry.
is going to be
Please
read
go ahead.
to the record. It's a retirement. She could not be here today, so I'm just going to read it. It's going to be given at another time. So it's for Mrs. Yolanda Lara with the Sheriff Department, and the resolution reads as follows. Whereas Yolanda Lara was born in Laredo, Texas, and raised in Dallas. She graduated from 8th grade Spruce High School. In 1989, she earned an associate degree in criminal justice from El Centro College before earning a bachelor's degree in sociology at the University of Texas at Dallas in 1993. In 2010, she attained a master's degree in professional development, and whereas she joins the Sheriff Department in 2006 as an assistant director of programs and was promoted to director in 2010. And whereas she has served as a Dallas County Felony Probation Officer, a Dallas Independent School District Liaison, working in developing recommendation, truancy policies, and Immigration Information Officer for the Immigration and Naturalization Services, a forensic case worker for mental health and retardation, and an investigator for Child Protective Services and the City of Dallas in the Mayor and City Council office and as an executive assistant. And whereas Ms. Lara believes in serving her community, she has served as the chair of the Community Advisory Board for KERA, Channel 13, and as board trustee for Dallas Children Advocacy Center, concentrating on legislative affairs. And whereas, as a member of the Hispanic Forum of Mesquite and secretary of the Hispanic PAC of Dallas, Ms. Lara oversees the county educational and rehabilitative programs for over 6,500 inmates on site. And whereas she is also the first woman to serve in the position of director for the Dallas County Sheriff's Department, Ms. Lara mentors and heroes and her parents and family, and is forever grateful to them for their continued support and encouragement. And whereas Ms. Lara is married to a senior sergeant, Raul Reina, and has 2 kids, Miranda and Brylan. So now, therefore, be resolved that the Dallas County Commissioners Court does officially congratulate and commend Yolanda Lara for her many years of service to the City of Dallas and Dallas County, and therefore extend their sincere appreciation for all her contributions and send our best wishes on her future endeavors. And I so move.
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously.
Thank you.
Good luck, Yolanda.
Yes. Oh, like you always say, the best is yet to come.
That's right. He's not done yet.
And this takes us to our presentations. The first is from Health and Human Services. Dr. Juan.
Dr. Juan.
Good morning.
Good morning.
All right. So reviewing some of our COVID situation, we are still in the orange extreme caution status for our risk level. There are some positive signs, but we're certainly very concerned about what's going to happen after school, with schools reopening and persons getting, again, more close indoor contact.
Dr. Wong, can you spend a moment and talk to us about what actions people should be taking under extreme caution? Because we have the guidance from CDC now, getting rid of kind of the 6 feet separation and all, some of those other major staples of preventing spread. So what, if anything, differs in the behavior that Dallas County residents should take versus the guidance that we've seen from CDC?
I mean, we are still pretty much advocating consistent with CDC, but as we've said throughout, anyone who's at higher risk for severe illness should certainly take added precautions, wearing a mask, still avoiding crowds. Absolutely everyone should be updated on their vaccination. If they haven't received any vaccine, to get that primary course and then get any boosters that they're eligible for. If you're indoors and in a crowded situation with poor ventilation, it makes sense to go ahead and wear the mask. And as I'll show you in a little bit, the subvariants that are circulating now, again, are these extremely easily transmitted variants. So again, there's some positive things, but then there's also still a lot of transmission. We're not out of this yet. We're anticipating some of the other boosters becoming available later in the fall. So it's not a lot of difference from what we've said throughout. A lot of it is sort of common sense to do all the things that you can, protect yourself where you can, and particularly if you're at higher risk or with family members at high risk. So as you can see, again, the ICU beds, we've been pretty level in terms of that availability. For suspected and confirmed emergency room visits in the prior 24 hours, that seems to be leveling off a little bit over the last couple weeks. Confirmed admissions in the last 24 hours, we are seeing some of the hospital numbers starting to go down slightly. And again, the hospital admissions has gone down slightly in the last couple weeks. And some of the hospital, I'll show you the hospital census inpatients have again also started to decrease slightly over the last few weeks. But as I said early at the beginning, the total number of cases, we're still seeing, like it was for the general population, about a 2.5% increase week over week for the prior week, and then for youth, about a 7.4% increase week over week. That's slower than what we've seen. It does seem to be leveling off, but again, we're not sure, as school reopens, anticipate that could go back up again, as that's what we've seen with prior sort of commencements of school. And then the deaths, fortunately, have remained very low with this, and that's what we're seeing with these latest variants and subvariants that are circulating. The severe illness and deaths has been low, and particularly deaths, because multiple factors, but also because of the vaccination and protection that persons in the community currently have. The other factor that we're worried about with the fall is certainly the longer time period that's transpired since people have received their vaccine or their boosters, and that protection then waning over the time.
So when is the next available period by which those individuals can be immunized? What is anticipated? I hear them say September. Is that?
You're saying for the new boosters?
Yes.
That's what we're hearing, but we're hearing probably the same thing that you're hearing, and haven't heard any more than that. I know that in Europe they had some review and are reviewing some of the vaccine, so we're hoping that it will similarly be here available. Probably September is what we.
Well, the only reason I ask is because that's a few weeks away. Are we talking about the first? Have you heard anything in terms of your communique with regards to approximately the availability in the marketplace
of this new
Yes.
boosters?
Yeah.
Again, nothing more than that approval we're hoping will be sometime in September, and the availability perhaps in that time period. But that's again, there's been sort of this uncertainty throughout, as we've seen, but we're hoping for that. Here's some of the vaccination status for us. Currently about 70% of persons 6 months and older vaccinated with at least one dose. Fully vaccinated, about 60%, 6 months and older. But for the 65 and older population, 94%, 95% at least one dose, and 85% fully vaccinated. The vaccination trends, I think the last week we had about 1,825 first doses per week. That's declined somewhat from the prior week. Again, we've been hovering around that range. The vaccine demand, even for the boosters and everything, has just sort of certainly not at the levels that we saw earlier during the pandemic. And then this is some of the demographics of those that have been vaccinated. Again, about 1.8 million vaccinated with at least one dose, 1.59 million fully vaccinated, and about 639,000 with at least one booster.
And Dr. Wong, after a person gets COVID, if they're not up to date on their shots, when would it be prudent for them to get up to date on their shots?
Right now we're still saying for people to get, if they're not updated, get updated now.
Okay.
Go ahead and get that protection.
So John Q. Citizen gets COVID on August the 1st, and he gets over COVID on August the 10th. Can John Q. Citizen go into CVS or Walgreens, wherever? Should he go get a shot in August or wait till September? Or?
Yeah, they can. From the start we've said early on, persons, if they just get COVID, could potentially expect for protection for about 90 days. So they could get it immediately. The one thing is, if they have COVID, don't go when they're still infectious and but then they can wait. They previously have said, up to 90 days of protection from infection. You could wait that long for the next shot. Although now with some of the latest variants, that seems to be more breakthrough cases that are occurring. So it's not, it wouldn't be discouraged to go ahead and get that vaccine earlier.
Yeah, because I'm seeing in the literature now with the BA, 4 and 5, breakthrough cases happening even a month after a person has that. And I know some of our pharmacists are still saying, why don't you wait 3 months? But if we're having breakthrough cases of this new variant at a month, particularly if the person is a smoker, older, diabetic, high risk of any type, they need to hurry up and get
go ahead. That's what. Go ahead and get the booster, or as soon as you're eligible, is the best recommendation. And it has evolved over time. Because these latest variants, again, more breakthrough cases earlier on. And this is then again the variant proportions for Texas. This is for the week ending July 30th, and you can see the BA5 still one of the major variants circulating in BA4, and then we're also starting to see some BA4.6, which I think is being seen some in the Midwest. But all of these are very again easily transmitted. So here's some of the vaccine availability. Again, we have all of the vaccines available at all of our DCHHS clinics. We're still doing Ellis Davis Fieldhouse. You can also check the vaccines.gov, and still the pharmacies and other sites are providing vaccine testing. We have the Ellis Davis Fieldhouse, Mesquite ISD Memorial Stadium, and still again other sites that are available. And we have these outreach events for COVID vaccinations that are currently scheduled.
I want to thank you for providing some consistency to our outreach events. That's been a real challenge for us. I do want to charge you, though. I don't know what the deal is with the carrying a vaccine, but I've had at least 2 events lately Well, we've run out of vaccine. The last one, the immunization clinic, and prior to that, the one we did on Lipscomb Way in Grand Plaza Shopping Center. Needless to say, you know, it's difficult enough to get people, and I don't know what it takes. It takes something special. If I got to send a refrigerated truck, but you know, it's difficult enough to get them there. And believe me, when we run out of vaccine, they're not very happy. And, you know, we kind of catch the brunt of that.
Yeah, we can certainly look into that. Yeah, maintaining the cold chain is something that we have to, the logistics of some of that for all these different events, and I know that's even just to make sure that the temperatures stay at the required ranges, especially with the Texas heat has been an issue, so not wanting to put large amounts at risk and balance that, and certainly want to make sure we have adequate supplies. I don't know if there's other technology or other things that maybe we can pursue to give more security in that. Again, a refrigerated truck, I don't know, we could, if that's something, certainly if there's...
And I just use the refrigerated truck anecdotally, but, you know, it just doesn't bode well when we spend a lot of energy to get people to come, incentivize them, they're there, and when we run out of vaccine, about maybe halfway through the population,
Yeah,
you know,
no, absolutely, we do. If they're getting there, we want them to be vaccinated. So we can certainly check into what other logistics. Again, I know that's some of the balance that the staff have been looking at to make sure and try to predict how much. That's good that we're getting a lot of people still at this. I know they've also been doing back to school vaccines and other events. So, but I'll check.
That's part of it too. We ran out again the other day on immunization. That's my point. You know, and so if we need a courier, you know, stationed back at, you know, Dallas County Health and Human Services or wherever your reservoir is, then we need to have that available. And I don't know how many clinics you have going, but we always have a couple of clinics going. And as I said, twice we've run out of material, and that's just unacceptable.
Sure. No, none of us want that to happen. We can certainly see if there's other logistic solutions we may be able to look at with that. Again, sometimes, you know, that's what's been so unpredictable through some of this is just that fluctuation in demand for the different services, the testing, the vaccination, and so, but we totally agree with you. We don't want to have people there and then run out of vaccine. So I just know with the Texas heat, there's been some issues with making sure that the vaccine didn't get wasted or anything. So.
And I agree. And I've been on location, and some of your staff is very good, and we've all tried to manage the heat. I'm just worried about the constituents that appear and can't get serviced.
No, totally agree. We want to eliminate that from happening also. Okay. All right, just a few things on monkeypox, and this is the chart, just showing the cases by date of specimen collection. I will say, if some of these cases these are confirmed cases, but some of them are out of Dallas County too, so that's where the counts, when we report some of the Dallas County numbers may not, if you added up every single one, it's a little discrepancy, but this is for some of the surrounding zip codes also. But as of yesterday, I think we were at about 316 cases of confirmed cases. And you can see again the numbers.
Out of 800 in the state, and we still lead the state. We still lead the state
right.
in infections.
And you can see here's some of the locations of the cases as of yesterday, case counts, and certainly some hotspot areas. It is still at this point predominantly men who have sex with men. Who are testing positive, but again, as we've said, it's not limited to that population at all. But there have certainly been events where there's been high risk activity, and more transmission that's occurring. That's what we're seeing. The vaccination, and I gave you all sort of an update on some of the plans for that. We do, again, continue to work with the multiple partners with the vaccine distribution. We did, end of last week, received 600 vials of the vaccine. And then, with the recent FDA and CDC changes to the administration recommendations, so now each vial then could provide 5 vaccines. So that 600 doses we got at the end of last week actually translated to about 3,000 new doses. And then just yesterday afternoon, we received another 4,400 vials. So that increases that number so that it's a total, just since the end of last week now, of 25,000 doses that we have available potentially. And again, it keeps...
There's still a 2-dose regimen.
Still a 2-dose regimen.
Okay,
yes.
and I want to make this very clear, Dr. Wong, you and I have had this conversation, but publicly. If you already have the virus, you're not eligible for the shot.
Right.
We got inundated, and I don't know if we've ever made that clear, and I said that to you, but if you've got monkeypox, if you've got the virus, you are not eligible for the shot.
The vaccine, as we've said, is to prevent infection, and so we try to get it before anyone has any lesions, and if they do actually already have lesions, then we're not providing the vaccine. It's not a treatment, so it is for prevention. So that is. Currently, we are still, using the same eligibility that we talked about in the past: persons with close, intimate skin-to-skin contact with someone who's tested positive, or men 18 and older who've had sex with men or have had and who have had multiple or anonymous sex partners in the prior 14 days. So those are the highest risk at this point that we're continuing to administer the vaccine. Again, working with the multiple partners, that availability, and now with this recent shipment of doses, we're looking to continue to expand that. So that's what keeps changing. We'll keep monitoring those persons and situations where there are any cases. And again, right now, that's the highest risk population. If it changes at all or starts to affect any other populations, we would respond appropriately.
Dr. Juan, for the record, can you name the partners that currently have vaccine?
Yeah, and I think we've talked about many of them. We are working with Parkland, Prism Health. We've worked with the City of Garland, AIDS Health Foundation. NOMI is working with us at Ellis Davis, Abounding Prosperity. We're also still working with some other partners, the Resource Center and CHE, but I don't think they have everything in place yet to begin administration. But I do want to, it's not like, right now we're trying to coordinate that with them, so it's not like just go right to them necessarily and expect to get a vaccine, so we don't want to inundate any of those partners.
Definitely, and Parkland is using their doses for their patients.
Right.
And they all have bilingual staff.
Say that again?
They all have bilingual staff.
Yes.
Thank you.
I did send you an email. You said you were unaware. I do have that clip. I want to make it very clear. Dallas County does not endorse any fundraising opportunities around this pox virus. None. And I have the clip. One of the people you just mentioned have taken and used that clip to engage in fundraising activities. And I need you somehow to make sure that you make that very clear.
Sure.
You can have town hall meetings. I understand getting it out to the public, that outreach. But we do not endorse fundraising activities around this virus or any other virus. And
Sure.
it is being, it is being done. It is being done,
Okay.
yes.
All right. I think that's all I have.
Thank you, Dr. Juan.
Thank you, Dr. Wong.
Thank you.
And then just real briefly on COVID, I would be wearing a mask today, but I just got over COVID in the last 7 or 8 days. But I would remind people, I see a few masks in the courtroom. Masks are not required, but I can tell you I got COVID at a public health conference because I was around a few people, even in a mask. I was around a large chunk of people. And it is a very, contagious variant that we have here. So it is something to strongly consider. If you hadn't just gotten over this variant of COVID, you might want to consider wearing a mask in larger settings. It's, as many people reported, the variant is not that bad for those of us who are in fairly good health, but it does knock you out for a couple of weeks. And each day, sadly, this week, we've reported a death or two every day, and it's from this variant. Most of those are older folks, but it is still a deadly variant. Our next presentation is from Commissioner Price.
Judge, recently as we talk about archives in this country and how important they are to maintain, classified and non-classified, it is important. It is part of history. And we've got a presentation to you today that monkeys can get you hurt or killed. The mother of a Hawkins County 8th grader says in a lawsuit filed this week that her son was repeatedly subjected to racially motivated attacks, and the school system did nothing to stop them. The lawsuit, filed in U.S. District Court in Greenville Tuesday, details a slew of racially motivated attacks by white students, at least 3 of which were recorded by students and posted on social media. Erica Qualls contends in the lawsuit she repeatedly sought help from administrators at Churchill Middle School in Hawkins County, Director of Schools Matt Hickson, but they either ignored or they downplayed her complaints. Among the allegations in the lawsuit, white students chased the boy with a stuffed monkey and posted video on social media captioned, "Monkey chasing monkey." The boy was taunted during a mock slave auction called a NB. I'm gonna save y'all. Work with your imagination. A white student handed the black one a tag labeled 100% cotton and thanked the black student for picking the cotton for the shirt he wore. That the black student was given a drawing of a Ku Klux Klan member holding a torch and a noose standing over Monkey Island. I just hope that if this occurs in Dallas, there was someone at Parkland Hospital who could empathize to make sure that the executive with the bag of monkey mugs doesn't get involved, because monkeys can get you killed in America. And on today's date, as we talk about archives, the day after the United Nations voted to recognize the People's Republic of China, then California Governor Ronald Reagan telephoned President Richard Nixon at the White House and vented his frustration at the delegates who had sided against the United States. Last night, I tell you to watch that thing on television as I did, Reagan said. Yeah, Nixon interjected. Reagan forged ahead with his complaint, and I quote, "To see those monkeys from those African countries, damn them, they're still uncomfortable, even with wearing shoes." And so Reagan was recorded saying this to Richard Tricky Dick Nixon. Nixon laughed heartily and soon after told his deputy national security advisor, Alexander Haig, to cancel any future meetings with African leaders. The hatred Nixon had for Africans made it easy for him to. So I guess we shouldn't be surprised about monkey mugs at Parkland. If monkey slurs are good enough for the president, surely they're good enough for hospital executives who can get away with it. And the beat goes on.
That's an outrage.
Come again?
That's an outrage.
It is. But it's interesting about history, and we keep saying it, and it's though I know we keep talking about measure what matters are words. And that's what got a young man killed. And that is continuously in the organization that we have some oversight over. Executives get a chance to use it as a teachable moment. I'm also using it as a teachable moment. The judicial performance at Frank Crowley, and while there's been plenty of editorials to talk about how it has improved, I think at the end of the day, the Office of Court Administration, when they dealt with all of the peer counties, basically says that while all of those counties in their performance have reduced their caseloads, only 2 have increased. Travis County, I think, by 400 and something. Dallas County by 2,000. We're up 20,000. Felony cases, let me differentiate between what's happening on the misdemeanor side and on the felony side. I did see the midnight count. We are now at 6,300. 6,300. We're over 1,000 over where we were last year. But 2,000 more cases than our peer counties around the state. And we keep talking about performance, and as I said, I'm going to separate. The misdemeanor judges are performing. I know a lot of those cases that have felonies have misdemeanors with it, but the misdemeanor judges seem to have a process by which they are performing with a protocol that is definitely reducing their caseload. The 2,000 are in fact felony cases. So the overload, backlog, whatever you want to denote that court that we have established is still having difficulty, as far as I am concerned, with being able to monitor who is performing. The Public Defender's Office Ms. Richardson is very clear as to you and your staff and performing. And by the way, Civil Service Commission on yesterday, somehow under the indigent defense, gave you another, how many attorneys, investigators?
12.
Yeah, I thought 19 staff members to continue. And while, you know, we appreciate and know that you will continue to manage it, I still say we're not able to track what's going on with those individuals that are outside of the management of Dallas County and the courts. We're still having difficulty doing that. And I don't know, Mr. Reed, if you somehow have been able to get another protocol wherein we're able to track that.
We've been, Mr. Heichel and I have been communicating back and forth, trying to establish that. At this point, we don't have an established protocol for reporting. Do want to mention that you've already alluded to it. The misdemeanor courts have cleared 3,000 cases out of their backlog since the start of this year. And if they continue on that trajectory, they could clear the entire backlog that was produced by the pandemic by the end of this year.
And I did commend them and talked about that the other day with regards to our jail population, and they've demonstrated great leadership and work ethic. I'm still not going.
You also discuss in the last jail population meeting the people with immigration holds. Staying increasing over 100% and stayed longer than ever before. When
500, you're exactly right. Population with ICE holds has doubled. We have 500 individuals, and they're staying at least
180 to 190 days. That is also unacceptable.
Exactly. One of the things, again, the misdemeanor judges. No, I take that back. Judge Rocky Jones, Judge Rocky Jones, did say that she calls those individuals down. She looks at the case. If there's no path to extinguish the case, she issues a PR bond and tells ICE to come and get them. And so as a result, whatever they clear up with ICE, then they're able to return if that's the case, if they're not deported. But you're exactly right. 500 individuals. We had never had more than 200 and something individuals.
It was commented also that there was due to a glitch. What was the glitch about?
And, you know, I hear all of that glitch. I'm not buying. Mr. Patterson, Jim Patterson over at DMU has, in the Sheriff's Department, he keeps up with it. He understands. We have not had any indication that there is a glitch. The fact of the matter is those individuals, we've doubled the population, they're staying longer, and it's, again, primarily, and again, I appreciate Judge Edwards saying, we issue a PR bond if they can't resolve the case.
And let them out.
And
yeah.
they're out of here.
Okay.
You know, we're picking up that tab again. And all it takes is a little bit of creativity, you know, and work. But again, listen to who's doing. Judge Jones is on the felony side. I'm still having difficulty on the felony side of the aisle.
Commissioner Price, you'd mentioned we're almost at 6,300. When did we hit 4,000 in the jail? That was somewhere around 2020.
Well, I mean, we've always, what happened is pre-pandemic, we had gotten down into the 4,500s.
Right, and we kept it.
And we kept it there. It was costing us about $8 million.
Yeah.
As I said to your church class on Sunday morning, I know you didn't know they invited me, but as I said to your church class, that jail now cost us $12 million. And, 6,300, it's going to even be more. I guess what is concerning me is that, and we said this yesterday in the jail sanitation meeting. I see Chief here. When we have now less than 100 women from being at capacity, what that basically means that 930 women, we begin to have classification issues, we begin to have custody issues. As you know, a female cannot be in sight nor sound of a male. We had as many, yesterday in the jail sanitation meeting, I think we had as many as 870-something individuals, females in jail. And so I did ask Ms. Richardson and Mr. Meade to give special attention, along with criminal justice, to try to get as many of those females out of the jail as possible. And I don't know if you want to say anything, because I'd ask you to do that on yesterday. But the females, unfortunately, custody is designed for males. And when we get females into the system, we try to manage them, we try to get them out, but it creates a challenge for us. Chief Richardson?
Yes, it does, Commissioners. And we are looking at our cases, and we handle a little less than half of the indigent defendant cases in Dallas County, to see what we can do in moving that female population. We're finding that a lot of the women that are in for substance abuse issues and mental illness. And so I understand maybe there's some possibilities that we may target those folk that are dealing with opiate addiction. And we may have some money that's available to do that. So I know that Mr. Reed and Mr. Heichel are working on that.
Right, we did, and if the court will recall, I did ask administration to bring forth a plan for us to begin to use some of that opioid money. I agree, that works. But at the end of the day, there's no substitute for hands on the ground and for us to be able to manage what we're doing. Ms. Randolph, good to see you back, and see y'all mask up there, but we're glad to have you back. But your staff has done a wonderful job, even with parole. I want to commend parole. Parole is not letting people stay in, 200 days, 150 days. They're getting them out with those warrants, and they're managing it. I think right now parole is costing us about right at $200,000 a month. That's a long ways from 12 million, but they are moving, they're managing that population, and thanks to you and your staff for helping do that.
And today agendas reflects it very well, Ms.
It does. It reflects it well. Thank you, Bob.
Okay, let's
Yeah,
talk money.
I was just going to mention, I think we've gotten some very clear answers on our authority and ability to augment or not augment our district judges' salaries with that supplement. While it may be a little bit tricky to link it directly to policy, it is my understanding that it's entirely within our discretion to set that supplement as high or as low, so we could zero out every criminal felony judge. We could zero out individual judges. I think it would be appropriate to consider reducing that $18,000 stipend either by $1,000 or $2,000 in recognition of the funds that are being expended for that overflow court and the additional cost burden that has been placed on the jail. It is certainly within the power of those judges to decrease those extraordinary costs on the public, and they continue to refuse to do so and make excuses for why that situation continues to exacerbate. So I hope at some point we take a look at those $18,000 supplemental salaries that are given to our felony court judges.
It's fine. It's just related
What's that?
Related to some problems at Ellis Davis.
Oh.
All right. Is that the end of that presentation? If so, Ms. Watkins, you want
Not the end of the situation, though, so we will continue to review and monitor.
to give us your budget presentation?
Dr. Watkins, budget.
Good morning.
Morning.
As Aaron's queuing me up, thank you for your feedback. It was a lot of slides. I know a lot of information. So I tried to make sure that, based on some of the questions, that we have a better, clearer transition from the slides so that you'll see how the proposed rate works with the other rates. Okay, so let's get started. FY '22 budget and proposed, FY '23 proposed. So we're going to start with the year-end projection, just to give you highlights of what's hitting the budget as far as expenditures. 89% of the budget is salaries and benefits through the end of July actuals. Mr. Wilson gave me a new attrition rate, which has gone up from the 14 to 15.79%. And we do have record number of countywide vacancies, and we're offsetting those, you'll see, with part-time or professional services in some instances. And Mr. Wilson's been working with the different departments, especially those with front-facing individuals that they're short on staff.
Doctor, on the difference between the 14% that Mr. Wilson had and the 15.79, what does that, and on the attrition, what does that represent? I know he's got a piece in the budget on this recruitment of about $1 million and a half. So does
So
that?
Yeah, that's part of the recruitment plan that he was working with.
Right.
There's several programs that's listed in the proposed budget. I can, want to skip to that?
No.
Okay, so
I
yeah,
just-
that 1.4, it's a 1.4 million recruitment plan that he's been working, looking at different ways to be a little bit more innovative than what we've done in the past. And so he did give me a preliminary budget after doing some research and looking at other counties. We're actually going to be looking at seeing if some of those items can be pulled from ARP.
Before you move off that page, or you move off, I guess, if you want to, you were showing that at the end of 2022, we would have a surplus of 28 million. Is that correct?
No,
Where?
back up. Yeah,
No,
right
that's overtime?
The overtime.
It's overtime
I'm sorry.
projection, yeah.
Oh, surplus, no, yeah.
No, it's not, and the reason we, again, in jail sanitation, yesterday, Sheriff brought up, was talking about city of Dallas, and I know different, they got a police department, got a $200 million,
Well, let me ask this. Will there be a surplus at the end of 2022? I know you're talking to us about if we went to the no new revenue rate next year because of inflation,
$2 million.
there would be a deficit of 29 million or something.
27.9.
Okay.
Okay, and so
Hey, go ahead.
before you get to that next year, what about the end of this year? Will there be any money left over?
So on that, some of those are carry forward. I know you were asking me for a specific look at zero, but when I looked at the revenue, our revenue is down. 644 million was the projected budget, and now the mid-year projected is 635 million. So it's already down starting off. So it's,
will
it won't be
end
a,
the year as a deficit, or will we end the year at zero or a surplus? I'm talking about 2022.
and so it depends on which one I plug in as far as one of the rates.
No, not the, no.
This
year. It's
Not
the current
rate.
For
The current
next year.
fiscal
Oh, so for the current rate?
Yeah.
So for the current rate, if we use the 0.227946,
No.
No. The
It
current-
is what it is.
This year's
We're
budget,
talking about
not
right
rate.
now, that ends in October, that tax rate's already set in stone. Will we have money left over? Will we be in a deficit? Will we break
What
even?
we've collected this fiscal year.
So that's a challenging question based on, we have programs that we're still funding. You'll notice that we're spending money out of our emergency reserves. Remember, we have a policy of 10.5%, so we're already spending that money. So short term, you're gonna always have reserves because we haven't ran through that. But long-term thinking, we were going through the bond, and one of the things that we discussed was our spending on our reserves.
Okay.
And so,
Let me back up then and ask you to make it a simpler question. Assuming that we want to keep our reserves at 10.5%, which is historically what's been necessary to keep our bond rating high. So we're going to keep the reserves at 10.5%. Can you project for us on October 1st, when the new budget year starts, regardless of what tax rate we do for next year, did we run a deficit this year? Did we have a surplus, or did we break even and keep our bond and keep our surplus at 10.5%?
there's a lot, it's not a consistent, so we won't run through our reserves, so I will say that. So we will have those dollars there. But our reserves are lower than our budgeted amount. So last 2 years, when we look at the single audit report, the reserves was lower than a 10.5%. When you look at, it was 7%, Mr. Thomas, one year, and then 9% the other year. So I don't want us to get into the practice of continually go through our reserves. Ideally, we want to have reserves enough for 3.5 months or 2.5 months. Our average spend is $30 million a month. So if you look at that, we don't have enough money in our reserves to pay our bills if there's an emergency.
Going back to the collections question, really, so what was our gap in collections? We anticipated, what collections?
$644 million, and that was the total of all of the revenue on my estimate that Mr. Thomas gave me. I don't have it.
644 was what we,
644 million, and then when they came back and gave me my revenue estimate, it was 635 million.
Yeah, that's what I say. I had 635 million I had written down in general fund.
So as we get closer to, because I think we're going to make a decision on a tax rate here pretty soon, can you get a projection for us as to what our surplus or deficit for this year will be?
So are you counting emergency reserves as a surplus? Because
We wanna
I wouldn't
keep
count
our,
that as a surplus.
No,
No, because it's still below the recommended level, right?
Yes.
The answer is no.
So to go to general fund expenditures, we would, to go to the reserves, we'd have to spend all of our general fund expenditures in order to start hitting the reserve. That's why we hit the reserves, because there's nothing left in the general fund to pay those line items. So we're already at a deficit if we're,
Yes. So we did
Using our reserves.
3.5 million to sheriff last week. We had some for elections. Those are ones we don't have a choice on doing. So
So can you get us an email as to what, if it's going to be a deficit, what that deficit is going to be?
yeah, and we'll work together to get you the
Mr.
expenditures,
We
the
can,
revenue.
we can give you that. You're definitely looking at a deficit right now as we speak.
For 2022. I just want 2022, not 2023.
Yeah, you are looking at a deficit in the current year.
Keep going, Doctor.
okay. Okay. So where does the money go? So we spend like 42%, I don't know what's going on here, 42% on law enforcement, 14% health and social services, 10% for general gov management services, 28% justice administration, 3% community services, and then 3% other operating facilities that are included in that number, just to give you an idea of what's being spent. So Judge, you were talking about the different things. The estimates come from the property taxes, motor vehicle registration, intergovernmental revenues, fines, licenses, permits, and then miscellaneous reimbursements interest, and then we have our revenue grants as an additional resource.
Okay.
So this here shows you just for general fund, the year-end projection. You'll see here that the ad valorem taxes are down 6.9 million based on the 22 budget and then the projection that was provided. The rest of the revenues, you'll see some up and some down, but the projected revenue end is 3.77 million above the 664 that was budgeted for 664 million to 668 million.
And what is that 13.7 million Gen Gov? That's a
General
lot.
government, those are different charges of current services that we get reimbursed for.
Okay, so we're just getting reimbursed a lot more than we thought we were this year.
Yes, based on whatever was, so he gives me an estimate. Keep in mind, there's an estimate of revenue, and then through the year, it comes in.
Okay.
So the certified tax roll was provided on July 25th. Then the property, I don't know, this is going back fast. Property tax revenue reflects 75% of our general fund. That's not including any of the grant funds. So just to go back to the Senate Bill 2 for terminology, historically we use effective rate. That's terminology's been changed to no new revenue rate. So based on the estimates that were provided to Budget Office, using a no new revenue tax rate creates a $29.5 million shortfall to our budget. Using the voter approval rate, which was historically known as the rollback tax rate, the proposed rate, we talked about it on August 2nd. I got feedback not to use the max that was used, so that's why I used the voter approval rate. The voter approval rate creates a revenue estimate that maintains existing service levels, unfunded mandates, workforce investment, and courthouse security.
And so we talked about this a little bit yesterday, but it's kind of almost like Goldilocks and the Three Bears. The first one is too low. It's a $29 million deficit, right?
Yes.
And the next one is more than we need. It's a $39 million excess. So what is that rate where we are at near maintaining what we needed?
Okay, so the proposed tax rate that I built the baseline on,
Yeah.
and then we're gonna go to, that's what we discussed yesterday. I'll show you the no new revenue rate, the zero rate that you, scenario, and then I have the voter approval rate, then the 1 cent below the current, just to give you an idea of what that looks like.
Okay.
Okay? And so the budget was prepared based on 0.213879, which is the lowest property tax rate since FY 2011 for Dallas County.
So that's the maximum that you can charge, the 3.5%. Is that what that is?
Not this year. Not this year. Remember, we,
Yeah, this year you could charge more, right?
Yes, sir.
But is this 3.5%, this 21?
This is the
Okay.
3.5%. I did not get any feedback that I had anyone that wanted me to go higher. I can do that if you would like me to. Okay.
Well, we'll go through your scenario so we can talk about, what's on the table, workforce investment, all the issues. Just
Keep
go through
going,
your
doctor,
presentation.
so we can discuss what is the voter approval rate versus the current tax rate.
Okay, so this is the lowest one, the starting point for us today, okay? So how did we get here? The tax rate collection. So the Dallas County Tax Office, he calculates the tax rate in compliance with the Texas Reform and Transparency Act of 2019. I don't have any flexibility with that part of it, the process, and then the county auditor provides me revenue estimates. Once he gets a approved tax rate, he'll come back with a certified rate. So keep in mind, the one that he's given me is the second draft of revenue projections that he's provided. Okay, so I think this is where all you guys are wanting to look at here. So the no new revenue rate, that's property tax reduction. I think this is what the judge was asking me. The break-even scenario is what he asked me to look at. Then the voter approval rate, then the reduced current rate by 1 cent scenario, which is, all of these is lower than our current property tax rate, okay?
All of them?
Yes, sir.
Yes. Make that clear, okay.
So hopefully this helps, because it was a lot of information. So what does this mean? So if we go with this one, that means $29.5 million shortfall. We're going to have some type of reductions in maintenance and operations compared to previous year, period. Right. That means no new programs or projects. I have some unfunded mandates that we need to do, we should do based on the legislature. That's included in the other one. We wouldn't be able to do that. And keep in mind, on all of these, the debt service rate is higher because we're servicing a debt. So that stays the same no matter what. What changes is our maintenance and operations under each one. That goes lower. So that means you have lower amount of money to do programs and projects, okay? So when we look at this one, it's not a good starting point because we're starting in a hole. It covers the increase in the debt service, and that's how the estimate was provided to make sure we cover the debt service.
So in regard to no new revenue rate situation, this does not account for the possibility of going into some of our escrow accounts, because from what I understand, we have 83 million in a number of escrow accounts. There's some that we cannot touch, but there's at least $21 million in a number of these escrow accounts that can be, pulled into the general fund.
So you are here on today's agenda. We've been looking at the administration, Mr. Thomas, pulling those escrow accounts. Mr. Thomas' staff showed where a few of them we can use for automation. So that's an opportunity for us, and you'll see that on one of the court orders today. General fund cannot absorb it, so I'm going to recommend escrow account for that one. And then you'll see some other ones, elections. We were able to change that from general fund, you'll see on the agenda today, to different escrow accounts as well. So we're looking at that, and that's one of the policy updates is when the department comes to us to start using those as escrow accounts first. The thing is, you don't want to do reoccurring cost in those because you won't be able to sustain that long term. So it's like a kick in the can down the road, because at this point, 2 years from now, 3 years now, we won't be able to sustain that, especially if we're putting salaries and benefits. We may could do it for 1 or 2 years in a lot of cases, but we won't be able to sustain it. We tried this back in 2008. It didn't last, and so they ended up being rolled back into the general fund.
I mean, just as a practical matter, when those escrow funds are available right now, and yes, it is not ideal to kick the can down the road, but time value of money being what it is, if we end up taking full advantage of pulling all that we can out of those escrow funds, and if that ends up being $21 million, and we have to then raise the property tax to meet the outstanding $8 million, it would seem as though that from a purely financial decision, doing that in a later year is of no detriment to our financial situation. I mean, it will necessarily mean a higher tax rate in a later year, but using the money that's at hand, particularly when we have the opportunity to give a larger tax break to folks in what is a difficult time, does seem fiscally prudent. Is there any
But I didn't think all of that was available, though, Commissioner.
Not, and I can tell you, I have about $6 million worth of IT expenses that I've already been talking to Mr. Thomas about placing there that is not in the 23 budget yet.
Oracle.
Yes.
Yeah, the ERP system. And so there are some different opportunities that are easier based on some of the references they looked at us in the statute for those funds, I didn't want to put us in a position to move a lot of positions or move things in there that are reoccurring and is not sustainable.
I guess, I'm sorry.
So then what you're saying too is that there are items that are under consideration that have a different time frame. The investment in Oracle has a very short time frame. It must be done within the next year, 18 months, 2 years, as opposed to possibly some of the capital investment that we could postpone? I mean, are those kinds of decisions that we would be making also, right?
Yes, because Mr. Thomas has a short turnaround time of the funds that he's needing, and so that was another opportunity for us to use the escrow funds, and they do have, some of them have a provision. We looked at it last week with automation, and so that's an opportunity for us, but all of them don't.
Right.
Let me ask you a question, speaking of things that could be put into a different bucket. We are voting today on $155 million of bonds. We spend, how much are we slated to spend next year on improving building structures?
So the bond projects are outside of what's in the budget.
Right, that's what I'm
So I don't have
asking.
enough
So
even
what's
to
in the
fund all the
budget for
projects.
replacing water fountains and painting buildings and fixing air conditioners and all that for next year?
No, projects, I got a project list of $50 million. I
50
can't fund
million.
outside the 150.
Okay, so for next year's budget, in the budget,
It's not in there.
okay. What's in the budget? What's in the budget for,
Right now, I need a tax
Property.
rate so we can figure out if it's gonna, the amount that it'll be there.
so as we build a budget from last year, what is the
So
request from the facilities department to fix things? Things are gonna break, right?
Yeah.
Things are getting old, things have to be replaced. So what's that number?
The list that I was provided was 50 million.
50 million,
Do
okay.
we want to
And those
continue
were
with?
some deferred maintenance that had been put off that they were gonna come back and prioritize for me.
Do we want to continue with your presentation?
Oh,
Because
sure.
I think some of these items will begin to make more sense as we do that.
I agree. I mean, if you can continue, doctor, so we can ask questions after we have the whole picture.
So, under the break-even scenario, going back to what you were saying, Judge, so the new revenue, if I use that scenario, is 635. Keep in mind, we budgeted higher than that, and we've been adding funds to the budget throughout the year. So the easiest way to do it when I worked with the auditor's office yesterday is to understand that there would be no more maintenance and operation costs we'll be able to do next year.
Okay.
Because we're breaking even, it's zero additional
Okay.
revenue, correct? That was my understanding.
So 0 for the broken air conditioner under blue, right?
Yes, sir.
Right, okay. Had to go to emergency reserves every time the air conditioner breaks or the pipe leaks.
Yes.
Okay.
So we'll be using emergency reserves a lot sooner than we normally would.
Remember, when you do that, it affects your bond rating.
Yes.
Every time you touch
Understand
that
that.
emergency reserve, it will affect our bond rating long term, so we have to be very careful about that. You have a policy, 10.5% for your bond, for your reserve, so.
So we'll have no programs or projects, no market adjustments, and this is a big one for workers' compensation, because I'm getting from my sister's county, we'll see what happens, that they're doing 7% structure, 4% structure. So we want to stay competitive, so what's built in the voter approval proposed is actually 3% in January. So I'll know more once they have commissioners court and see if it's
So-
passed at 7% or 4%.
So this 2.1% or 2.1 cent property tax reduction would not amount to any increase in pay, correct?
No, sir.
Okay.
But you can pay your debt. You can still service your debt. It covers the
Right.
increased debt side.
But if a clerk makes $39,000 in a certain position this year, and we were to do that, that clerk would make $39,000 next year. in the midst of a bunch of inflation.
Yeah,
right?
but look, we just talked about attrition. We just talked about the new projections is 15%
Keep going,
attrition.
Doctor. Keep going.
Yeah, I mean, yeah, we,
Keep going. At this point, we don't have anything to say in these two scenarios. That's what
So the voter approval rate, and this is my starting point, and this is what the 3.5% cap that's under the Senate Bill 2. This is the starting point. So in this scenario, we would be able to fund the countywide priorities, which includes the insurance increase that's already in there, the capital equipment, and that includes some replacement equipment for SWIFTs. Sheriff's operations increase over what it is now, just to include some of the things that we put in there during the year. It's not a big increase, but it is 2.5 million. One of those things was the HB 766 compliance positions that's an unfunded mandate that we briefed Commissioners Court on mid-year, so that's included in that. And then the 16.22 unfunded mandate has 8 positions, and the different departments gave a presentation. Mr. Heichel kept trying to explain what this is to me, but I just know that it's an unfunded mandate, that it impacts the magistrates, mainly in the PD, criminal justice, and the DA. So those
no, we
positions
got to come
has
into
been.
compliance, yeah. We've got to come into compliance, period.
Okay. Okay. And then increased countywide security contract. So we do have a $4.5 million contract that's already been approved from Commissioners Court. It was part of that $7.8 million contract that Mr. Frost purchasing briefed back in June. That 4.5 was not included in this budget, our current budget, okay? So that's included now in the baseline budget. Part of this also is we do have an offset of $1.2 million in county security fees that is used toward this. And just to make it clear, Mr. Martin has a memo that's out to make sure everybody understands that this is a priority for the county as far as security for the courts and the security for all county buildings. We will start putting a memo in the budget book to show that what's being spent on county and court security, so that they'll see that you far exceed what's in the revenue of 1.2 million. Okay? Vehicle replacement is 2 million. We do have the electric vehicle replacement, 500, and then the infrastructure there, 500,000 too. Additional consideration, this is where the Human Resources Recruitment Program, the 1.4 million. Now, Mr. Reed said some of this may be able to be eligible for ARP, but he's looking at it, he and his staff. But it probably won't be all of it because there's positions and there's a media campaign, and it's an ongoing project that Mr. Wilson wants to bring under Dallas County. Internship program, 500K, tuition reimbursement. This is the first year that it's gonna be implemented, and it'll go through HR. 3% structure. This is effective in January. This is for non-law enforcement. We're including the law enforcement steps for 4.25 and then non-law enforcement for 8.5. I gotta say that for the record to make sure everyone knows there's a difference, okay?
Yeah, on the internship programs, and this probably isn't your thing, but one thing that I hope that we'll consider on those internship programs is finding some cap, whether it be 400% of poverty or something, so that the nothing against anyone's child, obviously, but the privileged child who goes to private school perhaps doesn't get paid for their internship, but the kid who otherwise would go work at a Whataburger because she's not going to get that opportunity, she needs money for the summer, she would get the paid internship. And there ought to be a way to do that in a way that is, you know, race neutral and all of that, but make sure that the kids who have been shut out of that free process have that opportunity and get those internships.
He's building the program now, and he's working with, I think, Dallas Community College too, as part of the program, Mr. Wilson. So for the reclasses, we have 2 categories here, the market survey reclass and then the reclassification. we had quite a few positions requested for reclass. So Mr. Wilson is already working on a comparative market study. So some of them were more linked to being competitive and for pay, and then others were really for a functional change. So that's where we come from. We have the market survey reclassification. There's a plug in there for $2.5 million. The survey he's anticipating it'll be finished in January. So then at that point, he'll probably come back to Commissioners Court to see what the priorities are as far as the list of the reclasses or the different positions and titles. That's a plug. It may be more than that the entire survey, but right now that's the plug for $2.5 million. The reclassifications that has some type of functional change in a job that HR needs to still look at, in both of these, the reclassification like before and the new positions, HR still has to look at them. They still have to review them for grade, but the reclassification is $500K. And then the 41 new positions, $2.7 million. Then replacement equipment is a plug. We had quite a few replacement equipment requests, and that's a plug number, and we're gonna prioritize. Some of them are for courts, so we physically actually go over there and look at, is it just old or is it something that needs to be replaced? Emergency management came up with a program that they proposed to the committee, and this is for, because we have all these new buildings, and making sure we have a safety coordinator stipend for those individuals that are gonna be designated as our safety coordinators is important, so they can give us direction and information, and especially in the new building, because I got stuck in the stairwell, didn't know where to go, so I think that's important to make sure you know where you're going. So that's $38K, that's being included there. I was asked, do I know if the employees have been determined who they were? I'm not sure of that, but I know they did identify 22 employees that they wanted to do this stipend for.
So with this scenario, can we effectively tell the taxpayer, we took as much as we could from ARP and we took as much as we could from escrow?
Yes, sir. And you can tell the taxpayers we are reducing their property tax by 1.4 cents.
Okay. I mean, I want to know exactly how much we've, additional that we've taken from ARP to make this work and from those escrow pieces, because I know, we mentioned the 6 million, but, from what I understand, there's 21 million available there in that escrow that we can get into this budget.
I think there's a little bit more. We're looking towards 6 to 10 million that we can use for IT projects specifically.
Okay. All right. Yeah. I mean, I definitely want to do all the due diligence on that. Take all the money at hand before we go and essentially
To the other.
raise
And
taxes.
the interesting thing is the ARP, initially with the CARES, we had a lot more flexibility. And then initially with the ARP, we still have flexibility, but they've had final rules that they have a lot more stricter guidelines. And some of the things that we pushed through before, or even some of the positions, are just not eligible anymore.
Yeah. Well, kind of the big fat target would be the overtime, right? I mean, there's a lot of flexibility in the overtime, and it would seem as though if we are doing the right things, right, we're not setting ourselves up for failure, but if we're doing the right things on the HR side, we're pushing a significant amount of ARP dollars to our 23 overtime needs, and at the same time, we're doing what we need to regarding HR, our 24 budget should reflect a much lower demand for overtime and, the more stability because we've hired most of those folks up. I mean, to me, that would seem like an excellent bridge and a way to keep the tax rate low.
But I don't want us to get into pipe dreaming either.
Commissioner, for the record, we are already pushing significant amount of overtime into the American Rescue Plan. So we will continue doing that going forward, but you're correct. The only thing that can bring down overtime is lower jail population and increased hiring in the budgeted positions.
Yeah, because some of that overtime is not movable, is not flexible.
No, we got to stay in compliance. I still say the sheriff's budget was
So it's $194
$94 million.
But this, it'll be 197 because of the additional 2.5. There were some positions that were included that, in the new positions, so it'll go up a little bit more too, as far as some of their requests.
Yeah, how long have we been working with the overtime and still continues to be a challenge? Because we don't have the personnel to hire and we can't retain them either. So,
But it's important to kind of, to notice when we're hedging that the fear is that if we consume a great deal of ARP now and we head into a recession, that basically we'll, leave ourselves out in the wind. That regarding the overtime piece, that should not be the case, in that if we're in a recession, we're going to be able to hire plenty of folks, regular hours during that time, and then necessarily that'll decrease the overtime demand.
So we're working with ARP team too, because there's retention programs that he's working with Mr. Wilson on. So that's hopefully a help, because we did brief that, the sheriff retention. We're gonna be doing that with the juvenile as well. So that'll help, but I'm not sure if it'll turn it totally around.
correct. So, let's go to the next area.
Okay, so this last one, this is kind of my wish list a little bit, but this is a 1 cent below. If we did this one, I'm looking, you guys not looking at me, so I know you don't want to do this one. Okay?
Well, no. Doctor, go ahead and do it, because we still have a reduction of 1 cent to the taxpayers. We still, being very
1
prudent,
cent.
but we get to do more. We will be prepared to go into a recession if that does happen.
Yes, and so on this one, it's 0.217946, which is 1 cent less than our current property tax rate. So it helps with replenishing the county reserves and do some other things as far as IT capital projects as well. And if I had a wish, maybe to be competitive, even look at 1% with the structure as well, with the 4%. But I know this is an additional 1%.
I do want to challenge that one point, though, regarding being prepared to go into a recession, right?
Oh, you can challenge it. If we have a crystal ball, Commissioner, we wouldn't be here.
Well, no. If hoarding money right now into a recession doesn't make sense, right? If we're in record inflation, and even if inflation tails off, right, the cost of goods goes down during a recession. So, less money necessarily to take in. So it doesn't make sense to hoard money now in that regard if you're preparing for
I
recession.
never call it hoarded.
It's not a matter of
I
hoarding.
call saving.
Well,
And preparedness.
Boy, is
That
it a rainy
way,
day?
I don't have to, be, biting my nails, if those scenarios changing, because Doctor, just correct me if I'm wrong. We're between Mr. Reed finding which programs we can use ARP, between seeing how Oracle is going to work out, right, Mr. Thomas? Between seeing how the HR recruitment is going to come out, how the felony judges courthouse are going to commit. I'd rather be safe than sorry, but I still would have a reduction of 1 cent to the taxpayers, and I get $10 million more. That's my point. Thank you, Judge.
Okay, so the budget development, I was asked this a couple of times when I was speaking with each one of you about the salary lag and if it's possible to increase it. I think this is a safe number here. Right now, we do it at a negative 2.5%, which is a negative 9.7 million off our budget. That means that we're only budgeting 97.5% of salaries, okay? Another discussion I've had with you guys is about the vacant positions. This serves two purposes, especially as we're going into the implementation of Oracle ERP Fusion. This helps with that. Creating a position, countywide position report or department that is managed by HR and budget. It helps Mr. Wilson as far as the creation, and Mr. Thomas as far as these positions are already created. All he has to do is retitle them, and it'll help him as far as the transition there. 312 of these were 2 years old, and they're just sitting out there. They're not budgeted. So then we are moving them into a centralized place. Some of them are grants. but they're all funds, and we're moving them into a centralized location so that we'll have access to it. And it's a cleaner process as we go into the implementation of the new ERP system.
But doctor, what's the magic, excuse me, I'm sorry, what's the magic number on 97 and a half? Because I've watched us in terms of these vacant positions. And so if we're budgeting 97 and a half, what does 95 get us in terms of savings? So we should be up around, that's another 2.5%. So
So
it
you
should,
saying go up on it?
huh?
You saying increase it?
No, I'm saying just the opposite.
Decrease
I'm
that.
saying
Decrease
decrease
it,
it.
okay.
Yeah, and that should, I mean, I know it'll get,
Increase available funds.
because we can't.
Oh, I see what you're saying. So then I'll free up more money.
Yeah, yeah.
So I can work that and
Yeah.
show a scenario.
Right, because, we can only fill so many positions anyway, and there'll be some history over the last several years of what we've been able to do.
Okay, I can look at that too.
Okay.
There's another reality going on too, from what I understand from Mr. Wilson, that we are now going through approximately 1,000 new employees being upped this year as opposed to an average about 500 in prior years.
Right.
Which means that we're losing more people, we're having to replace more people, which is at a cost to HR as well as each one of the departments who are affected. So there's a reality out there. You talk about we can't plan on something that's going to happen in the future. We don't have those crystal balls, but we do have indicators, and I think this 1,000 replacement hirings that we're going through is part of that reality.
But that was strictly to deal with primarily physicals, taking the load off of our in-house and putting them out there, everything except law enforcement.
Correct, and law enforcement continues to be a challenge. It's everywhere. The shortage in Texas has reached crisis level. I mean, that is not only in Dallas County, it's all over the state. Right. So we need to be sure that we're prepared to better pay, changing perception, help recruitment, and retention. And for that, colleagues, we're gonna need money. Thank you.
So this last slide was, I'm a visual and person. So this one shows the percent of tax, of our tax bill comes from Dallas County. And so the first two, Dallas County and Parkland Hospital, those entities, Commissioners Court do set the tax rate. I'm using the FY22 tax rate. This is a very quick little scenario, just to give you an idea of what it looks like. And then the FY23 proposed tax rate was used for City of Dallas based on what was last published. And so when you look at this in a house, and I use $360,000 as far as the taxable value provided. When you look at the breakdown and how the tax bill breaks out as far as the different entities, you're doing a great job as far as commissioners, because Dallas County is 9% of that, and you're very conscious of it. So in this scenario, it'll be $821 of a $9,361 bill, and then Parkland, $918 of a $9,361 bill.
And just for the record, Doctor, this puts at a 0.22. The last
Yes.
scenario you show us, it was a 0.21, which still gives our taxpayers 1 cent.
Yes, sir. Yes. Okay. Greater unmet needs than we can fund. Dallas County departments, they came in and they submitted budgets, and they did their presentations to the budget executive team. There were over $64 million in unmet needs requests during the FY23 budget process that they shared with us. Based on the VAR, the voter approval rate, it allows Dallas County Commissioners Court to fund 37 million program priorities, which include unfunded mandates and an insurance increase, but there's still 27 million in requests remain unfunded.
With the last scenario that you gave us with 1 cent, we still have 27 millions that will not be funded. Thank you.
Okay, so next step, September 6th, we'll move forward unless you guys give me some different direction, the voter approval rate, for the or the 1 cent.
Thank you, Doctor.
Okay, so fiscal priorities.
I'm there. I'm not going, yeah, I'm there.
I'm not.
Well, I'm gonna wait let's get a little bit closer to what our final numbers are gonna be.
So you're gonna give, you're waiting for the deficit from Mr. Thomas? Because he will not give me a certified estimate until I have a property tax rate
Set.
Yeah.
set.
So we need to make a
So
decision.
so he'll give that to me once
So
we get
it sounds like we have maybe 2 commissioners for the 1 cent reduction.
1 cent.
Yeah.
And I think we probably have commissioners for the tax, what's the 3.5 cent one, 3.5% one.
We don't have all the information yet.
So why don't you run it at both numbers?
But
Do
you're
the both
saying
numbers?
she needs information to be able just to go forward. We need to
So
set.
like on September 6th, I need to have a tax rate court order on the agenda and, so you guys can vote on. So Judge, what are you saying?
I'm suggesting, since you've got 2 schools of thought up here, I mean, if Commissioner Koch jump in, but I don't have your school of thought covered, but, run one at the 1 cent and one at the, what would that be, 1.4 cents?
The voter approval
Action.
rate and the 1 cent, Doctor. That's what he's saying.
No, we have to be under the voter approval rate. I mean,
We'll run one, okay, what do you want to run at?
Commissioner, go ahead.
I mean, you gotta get to 3, so I mean,
Well, I mean, at 3, you don't get anything.
I mean,
That's simple.
I wanna
You're in the
see-
negative. You have to look for 27.3 million.
yeah, I wanna see exactly how much we can pull out of ARP in that,
You know,
those escrow funds before we go much further. I understand that, we're not gonna be able to do no new revenue rate, but, the 2.1 cent, how can we get further down from there?
but, we keep talking about ARP. I mean,
You're saying somewhere between
It-
2.1 and 1.4?
Somewhere between here. Between no new revenue rate and the 2.1.
No new revenue rate. So the,
1 and 2.
Okay, now the 2.1, just so for clarity's purpose, that means no salary increase at a time when we have a 15-point-something%, retention turnover problem, which will, if we have inflation, it's gonna mean we're gonna lose a lot of employees.
I don't think we're, okay. Well, I just wanna see how much we can get out of,
so you're saying,
But
I'm sorry,
are
Commissioner.
you saying you want it between the 3.2 and the 2.1, or the 2.1 and the 1.4?
I wanna see how much, yes, I wanna see how much we can pull out of ARP and how much we can pull out of the escrow accounts.
Okay. So Charles, can you do that? And then so I would think that, here's how that could work out, Dr. Watkins. You do one at the 1 cent rate, okay, that's easy, right? You could do one at the 1.4 cent rate,
Okay,
and then
The
once
one in
Mr.
between?
Reed gets you numbers for how much theoretically could, and I realize this may be a little bit of a broad stroke, but how much could be pulled out of those escrows, et cetera, just take that off of the low number. Make sense?
so keep in mind, the projects we're looking at has nothing to do with none of these projects up here. So the projects that I'm talking about are projects that are in a queue that either been approved or there's something that is gonna be coming up soon as far as the IT. So those are outside this one, so they would not be as part of this list here. So
So Commissioner Koch wants to look at those escrow funds. Hypothetically, let's say that the escrow funds come out to exactly $10 million that could be used, hypothetically. Then you take that $10 million off the lower of these 2 rates you're doing, and you'd have another rate. Does that make sense? So the high rate is only a 1 cent reduction.
Right.
The lower rate we're talking about is a 1.4 cent reduction.
Right.
If there's $10 million that can be found somewhere, then that 1.4 reduction is going to be higher. It might be 2.1 or whatever it is, or 1.8.
Well, here's what I'm recommending. We have to have tax rate September 6th, which is our next meeting. We probably need to call a meeting and have a budget workshop so that we can walk through these three scenarios with you folks before September 6th.
Just run the three scenarios and run them past the court members.
So just meet with you guys and run them past you?
We can do that and then just put something on the agenda September 6th, but I can't have a walking quorum, so I got to be very careful. We've got to be very careful as we do that. So
We can, when we get these, we can see if we need to have a budget workshop. The first two are pretty much plug and play, right? You've already got, you can almost just use the slide presentation. You've already got 1 cent and 1.4 cents.
I guess that's the question. It seems like there's already 3 for the 1 cent, so what are we talking about?
So I'm not sure where Dr. Daniel, I haven't heard from Dr. Daniel yet. I don't know where you're at, so.
I would say let's tentatively set up the budget meeting so that in fact we can address it without the walking quorum threat, for one thing. Because, this is an important thing that has to be done before 2 weeks, right?
But before
so we can set
that,
up a
we
time.
do need the math done.
Yeah, yeah.
Right.
We'll have to have that information.
And most of the information is already here, guys.
Yeah.
I mean,
You got
The one that's not there is if you find all this money and you take that off the lower rate, maybe it makes it, instead of a 1.4% reduction, it makes it a 1.8% reduction, or who knows, right? That's the math that has to get done.
Judge and Commissioners, for the purposes of running the numbers in the American Rescue Plan, you want us to look at recurring costs and at one-time costs, shifting over there?
Yes.
Thank you.
That's what makes sense.
So keep in mind, the recurring cost is gonna come back at some point.
Right.
And the no new revenue rate is not sustainable over a long period of time.
Well, that's an opinion, but,
I mean,
it may not be sustainable this year, but
it's not an opinion.
So
it's been sustainable the last 3 years.
You get a check, you get your check. You get 3.5% raise on your check. Your average TXU bill go up. Your credit card bills go up. All that go up, so guess what? You don't have any money left.
No, it's not sustainable this year, but it has been sustainable in past years.
And if we're an organization that's committed to becoming more efficient year over year, we should be able to hit that no new revenue rate, with the exception of some years that, there are emergencies and things that pop up. We're in a position where we have $500 million that was given to us by the federal government over the past 2 years in 2 tranches. And it's a little surprising that we can't shift, what is what is a little over 10% of those funds, or at least a little over 10% of the last tranche into making this budget work at its lowest rate possible.
Well, that sounds good, but that 10 billion spread over the next several years, Charles?
Yeah, Mr. Reed, tell us how many times the federal government has changed the rules that we still haven't been able to deliver a lot of the money for small businesses, minority diversion, and nonprofits. Tell us about those changes that have happened in less than a year.
So
And how much
we
money
did
has
receive
already been spent?
several rounds of guidance over the course of the first year of having these funds that made it very difficult to deliver the court's priorities. I will say, going back to the discussion around Senate Bill 2, want to provide some context around legislative intent. That 3.5% number for the voter approval rate was presented because of where inflation was at the time that the bill was passed. It was noted that several times that is why it was set there, because we had record low inflation. It may be the case that this go around, because of inflation, you just can't use the no new revenue rate. But that, going back to, and I'd say that to set up, moving recurring costs into the American Rescue Plan is going to be an issue, not this year, but the year we move them back, because we have to move back those costs plus whatever the inflation changes to those costs are.
Not to mention that under the non-new revenue and the voter approval rate, we won't be able to do any of the IT updates at all. So IT, will be one of the areas that will probably suffer the most.
Right. Well, you talk about IT, the equipment side, forensic, there are some other that has some very necessary equipment needs.
Exactly.
And so it's not just IT.
No, I agree, but I mean, being the chair and the vice chair of IT, that's what I mentioned, Commissioner Price, but you're correct. I mean, it goes all over around the organization, anything that is improvement.
Well,
So I don't think it is clear where 3 votes are. There's 2 votes for 1 cent. There's 3 of us that want to look at, that probably don't favor 1 cent, but that want to look at what the numbers can be. So I think we just need to get those 3 numbers, 1.4, 1 cent, and whatever number,
The one in
working with
between.
Commissioner Koch on work on the 3rd number.
Okay.
No, I mean, I'm foreseeing everything. I'm just making, the argument, Judge, of where we are.
I'm not critical of anybody. It just sounds like we're no one's at no new revenue rate. And there's 3 numbers on the table. There's 1 cent, there's 1.4 cent, and there's some number that's a deeper cut than 1.4 cents. And that's what we want to figure out, what that looks like and what that leaves our organization with.
Okay, so we'll set up some time with you once we get at those numbers.
We'll do that quickly and then determine whether or not we need to have that 3rd meeting. If I don't, after talking to at least 3 of you, figure out where we're at in terms of the rate, then I may need to call another meeting, and I'll let you folks know, hopefully by the end of this week. Correct.
Yes.
Dr. Watkins.
Thank you, Mr. Martin. Thank you, Dr. Watkins, for all your
Thank
work.
you, Dr. Watkins.
We do have Parkland here and there, have a budget presentation.
All right, Parkland.
Morning.
Good morning, Dr. Series.
I'm gonna wait till the presentation gets pulled up.
I thought you were dragging because you didn't want to hear my presentation. I can do it again if you'd like.
What's that?
My presentation, my weekly presentation.
He's here to present his commission.
No, I just wanted to help him out. It's up. It's up on our deal.
Yep,
What-
okay.
what?
See it.
Oh, there it is. Okay.
All right, so, good morning. This is, the, first of 2 presentations we'll do on the budget. This is our first, version. We will go to our board next week with our 2nd version and our final version. And so I'll tell you, we know that these numbers are gonna be changing. Not a great deal, but they will be changing between, now and that time already. So, let me just touch base on where we stand. And these are our major assumptions around the budget this year. More kind of uncertainty this year than in previous years. There's a lot going on between the state and federal government with the Medicaid program and the Medicaid supplemental payment programs. And so you'll see the district program, which was a major source of funding for us, that's the delivery system reform incentive payments in Medicaid. That program has been discontinued by the federal government, and the state is working to replace some of those funds. But short answer on that is we do have replacement funds. They don't get us back to baseline compared to where we were with that district program in place. The HARP program is one of those replacement pieces. That's a hospital augmented reimbursement program. That program has not yet been approved by CMS, and so that's an uncertain piece of the budget. We assumed half of that program in the current fiscal year, and that full program implementation.
Do you have
FY
any
23.
idea when they are going to let you know when that program is approved or not approved?
Yeah, there's active exchange going on right now. The federal government just issued questions back to the state on the state plan application, and the state will be submitting a response back to CMS, and then they have 90 days to make a determination, and at any point they can ask questions and reset the clock.
So see that, okay, so are you anticipating going in, so you're not programming any of that whole 90-day reset, 90 day, you're not anticipating any of that?
What we did this year, Commissioner, is we hedged, and we counted half of the HARP funds in our forecast, because we quite frankly didn't know which way it was going to fall, and we knew we'd either get a pickup or we would lose there. We still think that the state plan is an appropriate state plan and will get approved. And if it does get approved, it will go back retro to the time that the request was made. And so at this point, because we don't have it approved, we only included half of it in our forecast for current year. We've included the full thing in our budget for '23. You're familiar with market volatility. I'll go over our revenues and expenses a little bit, but our revenues are growing less than 1%, and our expenses are growing about 6%. Benefits are increasing about 6% on the health benefits side, and then drug costs are continuing to rise too, with the biggest impact in HIV and oncology drugs. The revenue picture is a mixed bag, where we see modest increases in Medicare and Medicaid and in commercial, and then reductions in some of the supplemental payment programs, the Medicare DISH program, the Medicaid DISH program, and you'll see we've modeled a 5% increase in our tax revenues. The volumes are basically flat, except for our outpatient clinics, where we're projecting 2 to 3% increases in those clinics, and that continues a trend that we've had over the past few years. And then on the expense side, we've modeled our FTEs to be flat. We've built in addition to the 3% incentive pay that we typically do, we've modeled in a 2% cost of living adjustment, and then another $30 million, which is about 3% in market adjustments. And the way that works is throughout the year, our HR group will look at the different job classifications and try to adjust to keep us up with market. So it may be in lab, it may be in radiology, it may be in pharmacy, but that'll happen over the course of the year where they look at all of those programs. We've seen a significant increase in our benefit expense. That's driven by two factors mainly. One is we hope to transition more people from contract labor to salaried employees. And when we do that, we'll pick up benefits associated with that. And we're also had higher costs related to our pension plan's market performance, which has taken a hit, and so we'll see some extra expenses associated with that. And then you see the assumptions for supplies and drugs. Insurance has increased significantly as well. And then our purchased medical services, that's our physicians, which we expect to see some improvement from that 9%, closer to 4% in the next version, so or below that perhaps. So those are our major assumptions. I'll walk through a little bit more detail on those. This just gives you kind of a little bit of deeper picture of some of the significant changes in revenue.
Before you go any further, Doctor, I'm sorry, she's bringing some notes I made. And
go back?
Your staff, yeah, that's okay. Your staff talked the other day about, I think, contractors. Was the number 80? Was that the number y'all used?
80 million?
The contractors. Yeah, and I think I was talking primarily about nurses.
The number we have in-house, that is, how many?
Or was it 300? What was it?
Over 300, yeah.
Was it 300?
But the number of contractors, 315.
Okay, so it's 315. I guess what I'm asking is, are we waiting for the budget, or are you guys already in some transition to talk about dealing with them, or before they get siphoned off?
Yeah, well, that's we had our biggest class of nurse residents ever this year. We've increased our entry level pay for that group, and so we're trying to attract more in, and then we're building some incentives so that when they finish their 3-year commitment or 2-year commitment, whatever that might be with us, that we build a bridge to retain them till they vest in 5 years. And so we've got a lot of efforts underway to try to repopulate. But it's just, every hospital is dealing with this right now.
Well, I know, but if you say you got 315 contractors, I just want to know if you're waiting on budget or if there's already an effort to.
No. We've been trying to convert what we can to paid staff. The market is such that people can demand higher salaries right now by being a traveler. If they don't travel at Parkland, they can go travel somewhere else. And that's just, that's the reality of what we're dealing with right now.
Okay, so I'm just asking if you think it's realistic that you're gonna be able to do it then.
Well, that's one of our, to be honest with you, it's one of our assumptions that we know is going to take some work and some factors that we don't have control over. But we're trying to make a realistic assumption. And, a lot of the early contract labor surge was fueled by federal relief payments to hospitals and states. And that really caused an increase in available funds and therefore what these agencies could demand. With the reduction, we're not getting federal stimulus payments anymore. And so as those payments go down, the hope is that the market for that contract labor will get more rational, where at one point before the pandemic, those costs were like 2 times a salaried person. During the pandemic, it was 3 times or higher what a salaried person could demand.
Okay.
So again, this is just some of the significant changes on the revenue side in the various categories. I talked, the big ones for us, the supplemental payments, there's a lot of ins and outs in that category. I talked about DSRIP going away and other things coming in to replace it, but just not coming in as much to replace it. And then we will be submitting more FEMA claims for that contract labor that has gotten so expensive for us. And so that's that.
I got $8 million on something that was regarding FEMA.
Probably the contract labor, we're spending about $8 million a month right now on contract labor.
That's what it was.
Right.
Okay.
So our cost report allowances, Medicare, the disproportionate share payments, those will be lower, not because our share is going down, but the federal pot is lower and we get a proportionate share of that allocation. You see what we planned in for our tax revenues, and then our stimulus funds have been expended now. We had about $100 million that were expended over 3 years, and so we don't have any of those included in the budget for 23. Medicaid DISH will be lower because of, one, the DISH program itself, but also the enhanced FMAP rate that we're enjoying because of the public health emergency. When that emergency ends, the state share of match goes back up by, I think it's 6.5% if I'm remembering right, but that'll be, we've enjoyed additional DISH funds because of that favorable match rate, and that will go away. And I mentioned the DSRIP program that goes away. The Medicaid uncompensated care program will pick up more funds, just not as much to make up the shortfall. And I already mentioned what we're doing with FEMA. And then the HARP program we talked about already. That's the new supplemental payment program that has not yet been approved. Going on to some of the expense assumptions, we are modeling our FTEs essentially to be flat for the year. We have work going on right now, productivity work, looking at establishing benchmark standards that we will hold each of our departments accountable to, and hold our FTEs flat or better than flat. That's what we've got modeled for the year. On salaries and benefits, like I mentioned, we've got a 2% cost of living built into the budget on top of the 3% average merit, and then the $30 million in wage adjustments that we'll do throughout the year. And I've already talked about the benefit increases. The $40 million reduction related to COVID is primarily related to some assumptions around reduction in contract labor, and then just the lower acuity, because the hospital's still full, but our acuity is less. We don't have as many people in the ICU on ventilators and such. And so that's what those projections are based on, and then supplies and drugs as listed.
Let me ask you something. The recent act by Congress that the president signed, will it impact you with regards to drugs? Because I think you had told $150 million.
on drug costs.
On drug costs. So will the new legislation impact you anywhere here?
We don't anticipate that for a couple of reasons. One is, we already get very good drug prices on the outpatient side. 340B program is a federally discounted program.
Yeah.
On the inpatient side, we don't get that. But the what is in that bill is the ability to negotiate for 10 drugs starting in 2026. And so we don't expect to see anything in the next year. One of the concerns is that, well, if they negotiate harder with Medicare, then will they increase prices for other payers? A lot of uncertainties associated with that, but they will have to have a rebate if they raise their prices in higher than the average, like inflation. Average manufacturer price goes up higher than inflation, and that could temper what they do to the rest of the, to the rest of the payers as well. But the bill itself is specific to Medicare. So, short answer is it shouldn't have an impact, certainly in '23. More on our expense assumptions, increase in fees, a lot of this related to IT, software as a service. Insurance premiums are up significantly as well. And I mentioned purchased medical services. I will expect that's a number that we expect to change by the next version. I talked about our productivity work and talked about keeping our FTEs below. If you look at our productive FTEs, are projected to go down by about 100, and paid FTEs mitigated a little bit because of training and orientation time that we have to spend. But the point on that one is we're putting a lot of focus right now on benchmarking and looking at our FTEs to try to try to be as efficient as possible there without impacting our staffing ratios and things like that for patient care. Now, these are just the graphics of the past few years of our volume trends. Remember, adjusted patient days, that's our inpatient days with an adjustment factor for our outpatient activity. And we're projecting that to increase just slightly. Same thing for hospital discharges. That's our total and our regular admissions and our observation stays. Our deliveries, we're projecting to be flat. Our ER and clinic activity, urgent care activity projected to be flat. And the one area where we're expecting to continue to see growth is in our outpatient areas, and that's intentional. We're trying to continue to address, preventive care, managing chronic disease, and keeping people out of the hospital. And so we'll continue to invest strategically in our outpatient activity, whether that's physical access points or our virtual care projects. And so here's our income statement and our projections for how we expect to finish 2022, and then what we're looking at for 23. And I'll draw your attention to the first light blue column, and that's the hospital activity itself. It doesn't include the nursing homes, which that gets included in the next column and summarized. But on the hospital side, you'll see our operating revenues going up by less than 1%. Our operating expenses will go up by a bit more than 6%. And so we're projecting right now for 2022 a net income of about 5% or 145 million. We already know, based on our updated projections, that number is going to come down some before we bring this back to you, probably closer to 120 million or so. That's still just above our budget of about 100 million for the year. If you look over to the right and you see the first peach column, the budget for 2023, and you look down at the bottom line of 27 million, that's about a 0.3 operating margin, that bottom line. And so what you see again, it's just it's a trend that we've seen now for the past couple of years, and that is, as our revenue doesn't keep up with our expenses, our margin is getting smaller. And then we look at that in some detail, going out 5 years, to just show you the trend. And what you can see, I'll just draw your attention to that middle column where it says operations net inflow. This is our budget just looked at on a cash basis from what we expect to get in from revenue, what we expect to actually spend, and you can see that number. And then we will apply our capital expenses that we will incur to get to a net cash number. That's that shaded row at the bottom. And you can see for 2022 that we expect to have a net cash inflow of about $88 million for the year. That goes down to negative for 23. We have a positive inflow, if you look again, that middle row, of almost $100 million, but once you take into account our capital commitments there, we go negative on our cash flow. And you can see out to 5 years, we'll go from 176 days cash where we are today down to a projected 35 days of cash. Now, obviously, we're not satisfied with those projections, and so the work that we have to do is things like productivity work, looking at our cost of business and making adjustments there, and also working with the state and the Medicaid program to refill some of those supplementals that we've lost.
A quick question on that piece, because you talked about working with the state to increase some of the supplementals. There's also the issue of collections, in particular, collecting from adjacent counties and other entities where individuals would be responsible for the indigents that reside elsewhere. And we've had a couple conversations about this over the past couple of years. Just roughly, I know the numbers aren't in here, but regarding the cost to collect compared to the expense of the care given, what's some of the analysis that's gone into that, and are there opportunities to start? I know we've done bulk billing to the adjacent counties. Is there an opportunity that at a lower cost to collect that individual billing can begin or restart from when it existed far in the past?
Yeah, that's a good question. We've got some work in that area right now. Generally, the surrounding counties are the surrounding counties are more restrictive in what they cover than we do. And so, I went to visit Calhoun County a few weeks ago, and their message is, if someone qualifies for our program, which is 100% of the federal poverty level, then and you sort of make that application to us, then we will pay for that. We tend to get very little from the surrounding counties for indigent care there, but we do have an effort going on right now looking at, are we alerting them timely within their guidelines so that for the ones that are eligible, we're getting reimbursed for that. But we generally, as you said, get reimbursed at a very small level, mainly because their eligibility criteria are much tighter.
And that's been happening for the last 20, 30 years. They dump it.
Yeah. Okay, this is our capital budget. You'll see, one of the things as the dollars get tighter, our discretionary projects go down. And over the past couple of years, when we had better years, we were able to do things like, rebuild our specialty clinics without taking on debt, shore up our pension plan without taking on, sort of relieving future debt. We purchased a Hatcher clinic to avoid future debt payments. So things like that, you'll see that activity decreasing. And in our capital budget this year, we've got two major equipment projects. One, replacing a big pharmacy robot that's a multi-million-dollar project, and replacing our communications for our police force, which again is a big ticket item. But generally speaking, what our focus on capital is going to be is replacing equipment that just gets worn out. And when you replace a CT machine or an MRI, that's a $2-3 million item. And so we've been in the hospital now for almost, I guess, about 8 years or so, and so we're starting to see the routine replacements, and that's going to be just a steady state over the next few years, over the next years into the future. Not the next few years. It's just going to be a regular cost of operation. And now just on to the tax revenue. We know that the valuations are estimated at about 15%. Our current rate is 0.255, and what we're proposing is 2.358, which is a tax revenue increase of 5%. And if you look at just sort of historically what our rate has done, as you know, we've tried to keep that at about a 4% increase. medical inflation, particularly for this year, is about 5.5%. We've tried to maintain a steady state there, even though valuations have been much higher than that. And so you see the rate going down year to year. And if we were to land at the proposed rate, that'd be about a 7.5% reduction from where we are currently in 22. And then this is a summary of our debt service. Happy to answer questions about that. And then the calendar of when our next presentations are. We'll go back to our board and then come back to the court with a final presentation on September the 6th. Happy to take any questions. And we have our team here too.
I just want to say thank you very much during an incredibly volatile time period where healthcare has taken a lot of buffering around. I really appreciate you and the services of all the people on your team to, first of all, watch what's going on, and second of all, the activity level in looking for better prices for pharmaceuticals, for using facilities to better degree, and the variety of things that have been explored to use taxpayer dollars as efficiently as possible. So thank you very much.
Well, Dr. Cerise, thank you so much for the presentation. I know you're still working on this, but obviously it shows that, Parkland has been a good steward, during this pandemic, and continue to be the public hospital that is the best, in my opinion, in Texas and, of course, in the United States. And it couldn't be without, being very, budget conscious, and you continue to take care of the taxpayers as well with this budget. So I look forward to the next presentation. Thank you for answering my questions, Dr. Cerise.
Thank you.
I think that made the presentation a lot shorter. Thank you.
Hopefully you saw the article this morning in the paper with regards to those neighborhoods that are basically still severely impacted with regards to access. Jubilee Park, Dallas Minority Neighborhood, face major transportation issues. The new SMU study shows. It's nothing new for some of us. We say 40% of our community, of my community, is transportation deprived. And as a result, it's an imperative. That's the reason I can support the CO PCs. I did talk to Pat Jones and Dr. Harris and Dr. Thompson with regards to the custody budget. And apparently they're working on that. But this basically still says, we're still a tale of two cities, and it still says, and by the way, Dr. Millay, Jubilee Park is #1 on the list in terms of access and all, and it's not even in the heart of the community. All I'm saying to you is that, yeah, Parkland is that safety net hospital, but until you begin to do real outreach, continue your outreach into the community, at the main campus is fine, but you've got to get into the community, and that's what. Yeah.
You're correct, and we are paying attention to that.
Right. And the community health needs assessment.
I have committed to update you on that in September, because right now.
Mr. Malaise, would you come forward so that we can hear what you're saying? Thank you.
I don't like to upstage the boss, but I've committed to bring that to you all in September. I talked to Daryl about it because right now we're doing the evaluation on the past one of 3 years. That's required by law for us to do an evaluation. And we are concurrently, as you know, working on the next one. So we'll be able to present you much of the findings on both of those things in the next month.
Thank you.
I wasn't able to glean that when I
apologize.
I wasn't able to glean that in trying to go through this budget.
That was my fault. I apologize, Commissioner, but we'll bring that to you.
Okay, thank you.
But Jubilee Park looks very nice.
It's a nice clinic.
Yeah.
Congratulations.
Well, I still invite you to.
Oh,
Okay, thank you.
okay. Thank you.
Thanks.
Thank you very much.
All right. This takes us to our consent agenda.
Don't we have another presentation?
Oh, I'm
no.
sorry, we
Yeah.
sure do. We got a presentation from IT. Come on forward.
Our presentation ready today. That's tech share, right?
Yep, good morning, Judge. Is it still morning? Just barely. Good morning, Judge. Good morning, Commissioners. My name is Omar Rodriguez. I'm the Assistant Chief over the IT Project Management Organization. I'll be doing the presentation today. Our CIO, Melissa Kraft, can't be here on site, but she has joined us via phone, so she can help answer any questions that we might have. All right, so IT was tasked to come up with some options on the tech share portfolio support model, and that's what we'll be going through today. There's really two options, what we have currently, and then bringing in that support model to a complete Dallas County support. We'll also be breaking it down into two divisions, and that is the hardware, software, infrastructure side of it, and then the personnel that we'll need to support that. Trying to move forward. All right, so our current support model is, of course, we are paying maintenance to TechShare for them to support infrastructure, software updates, things like that. Let me go back one. And currently, as it's set up, we have four distinct systems, of course. So we have TechShare Juvenile Case Management System, the TechShare Prosecutor, the TechShare Magistration, which is the MAC portal, and then the TechShare Indigent Defense. And if you look at how our hardware is set up, right now we have the TechShare Prosecutor, which is hosted by Dallas County. That means it's on our servers, it's on-prem. Let me see if I can get to that slide. There it is. And then the other three, which is the Juvenile, MAG Portal, and Indigent Defense, those are TechShare supported. They're in the TechShare cloud, and that's where they are. So that's the current hardware and server model. As far as personnel support, here's who currently supports the model now. So right now you can see Prosecutor, MAG Portal, and Indigent Defense. We do have Dallas County analysts, developers, and quality assurance people that help support those. And then TechShare JCMS, which is the Juvenile. We don't have analysts that specifically support that. That's completely done by TechShare and also by Juvenile. They have in-house subject matter experts. So if we're looking at bringing this in-house to Dallas County, that would kind of be an unknown for us. So if we go to the second support model, which is solely supported by Dallas County, we do need to make some assumptions. So for staff, county IT would need to evaluate the code. That would take us about a year to do, looking at that code, understanding it, making sure how we can manipulate it and manage it if we need to. The estimated transition for TechShare would be about 12 weeks. We're basing this on how long it took Collin County to do the exact same transition, which was about 10 weeks. And then we would also feel that total we would need about 3 FTEs to support the system. There would be 2 FTEs in the first year, and then in the second year, an extra FTEs. Those would be a dedicated senior developer, a senior business analyst, and then a quality assurance analyst.
And that's for all 3 products, not just Juvenile?
That's correct, yep. So that would be for all the 4 products that we bring in, the Juvenile Prosecutor, MAG Portal, and Indigent Defense.
If that all works the way you hope it will, if we were to do it, what's the savings?
We'll get to that here, but it's really going to depend. It's about $1 million, but we'll get to that here in a couple of slides. As far as equipment, of course, bringing it in-house, 3 of those platforms are in the TechShare cloud right now, so we'd have to expand our equipment in-house, which is about, we're estimating $200,000, and that it was basically doubling what Collin County had to use in order to bring in one of those systems.
But we're gonna use our existing platforms regarding cloud storage. I mean, we're gonna, yes, we're gonna have to expand server space and so forth, but it's not like we're investing in anything entirely new. We're just adding some additional bandwidth.
That's correct. Yeah, we're just going to add more resources to what we currently have. Some other assumptions have to do with, the changes, right? This is going to be new if we bring it inside Dallas County. We are going to have to take that year to, look at the code base. And we'll then want to limit any sort of changes that we need in that first year to legislative mandates or emergency changes only, right, if needed. The costs that I'm about to show you also do not include any enhancements or updates. So if we desire to have any, if there's some that are on the table right now that we would need to scope those in. And then finally, Juvenile will need to be configured. We do know that there are some changes that will happen. So after we do that code base study, we do know that we need to prepare for year 2 to make some of those changes. Okay, and so Judge Jenkins, I think this is maybe what you're asking here. On the left-hand side, you'll see what the TechShare current costs are. For 2020, it was about $2.4 million. 2021, it went down to $1.7 million. And in 2022, there's two numbers there. The first number for $1.67 million was what was proposed, so that's what they send us. This is probably what it's going to cost, the systems. And then the $1.68 million is actually what we paid. So just to let you know, any sort of forecasts that they give us, they do fluctuate. They can go up and down. And as if you look at them individually, Juvenile went up, for example, from $712,000 to $716, but magistrate dropped, right, from $253 to $240. So there are some fluctuations, but in 2022, $1,684,928 is what we paid for the TechShare portfolio.
Okay, and this includes maintenance and operation, though.
So what we're showing right here is maintenance and the operation. What it doesn't show is any change requests or anything that we had to add to change the code. So that's the 1.684 is just the maintenance, and yes, keeping it up and running on their cloud.
And then, but then including any advancements that were made in these particular projects across the state, because Dallas County benefits when improvements are made by other users of the same product.
Correct. So if there were some enhancements, bug fixes, things like that that were rolled in as part of maintenance, then they are included in this number. That is correct. Yeah. Okay, on the other side is the second option, bringing that into the Dallas County supported model.
Excuse me, just following through on that. So is that the difference between the 2020 and the 2021, and even, I guess, the 2022? Is that because of enhancement costs, or is that just purely?
No, Commissioner. No, so what we're showing now is just maintenance costs, right? So
Just maintenance.
Their maintenance and
So
operation
there's been
costs
no-
changed.
Okay, so I guess at what point in time do we start to see that there are, quote, enhancements? I mean, we've talked about that for.
Yeah, I'd like to get that information from TechShare themselves.
Okay, yep. So we did have enhancements in 2021 and 2022, and those were usually billed separate. And again, so those aren't in these, but we can get those numbers. We can get them from TechShare.
Well, we continue to laud how much, we're real beneficiaries since we were part of the initial. I just want to see what it is.
Yeah, agreed. So going to the in-house model, again, we're proposing the one-time costs, $200,000 for new software to host these systems, a $32,000 TechShare retainer service. So this is similar to what Collin County has done. If we needed any of their developer and their support for emergency changes or anything like that, we would have that retainer. And that brings the one-time cost total to $232,000. For ongoing costs, we're looking at $30,000 for that new hardware that we'll bring in, whether it's going to be licensing, upkeep, things like that. And then for staffing, we are proposing those 3 new additions. In year 1, we're looking at $226,000 for a senior developer and a quality assurance analyst. And then in year 2, an additional $103,898 for a senior business analyst. So moving forward, year 2 and on, the cost for those 3 FTEs would be $330,470. So the, again, one-time cost of $232 plus the ongoing cost of $360,470 gives us a grand total of $592,472 for in-house support. And then going back to your question, Judge Jenkins, so we're looking at about $1 million savings there moving into the in-house supported.
I have a couple questions about the in-house costs, because your FTE costs here are salary only, right?
That is correct.
So
thank
that
you
would
for
be
pointing that out.
another third of that total cost when you include the benefit package, which is part of the cost of employees, right?
Correct. So that is correct.
So this isn't exactly, I mean, that should be added. There also should be the distinction made that any enhancements that are occurring around the state by use of this product, we will not see any of that, because your plan is that there will be no change in the service being provided.
Correct. So under this in-house model, that 12 months that it's going to take us, there won't be any changes, to
Okay,
the
so
product.
basically, these two tables are comparing apples and oranges, because they are not the same service.
Yeah, so just to point out for transparency, one, the hardware costs, we would really have to get those specifications from TechShare, and they might tell us, oh, you need these, really expensive servers. We don't anticipate that, but we'll really have to get a good number on that hardware. As you mentioned, for staffing, it does not include, this is salary only, does not include benefits. And then, we have that TechShare retainer if we need to make any sort of modifications, but they wouldn't be like enhancements or upgrades that we would want, right? That would have to wait till year 2.
So this presentation, just to be clear, I mean, if it doesn't include everything you say, this presentation is just a snapshot to let us know that bringing it in-house might be a little less expensive.
Yeah, so the task was taking a look at what the options are, right? What we currently pay, which is the 1.684, and then what it would cost, on the top level of bringing it in-house. So that's correct.
But like Commissioner Daniel says, if you add the salaries and everything, it's probably going to be about 800, 900,000.
For salaries?
Good morning, commissioners. Can you hear me okay?
Oh, Ms. Kraft.
Ms. Kraft, you can't, unless you show your face, you can't participate.
I am. Just don't make fun of my bandage. So, can you see me okay? Hear me okay?
Hold on.
We can see you now.
Okay. So, as part of those costs, we would include any type of legislative mandates as part of that change, and we anticipate to do those if needed. What we won't commit to doing is making any large enhancements or updates to the systems, at least until we can get comfortable with the code base. There's always a potential that we may, but part of that, we rather assume that we can't until we go through kind of that code base evaluation as well. And one thing to keep in mind, Judge and Commissioners, we did receive direction from ITGC to proceed with an RFP for prosecutor and indigent defense this upcoming year. So we'll hope to start to do that towards the end of September. So I don't know if they answered any of your questions.
Well, but again, Ms. Kraft, I think the issue before us was this is not apples to apples comparison, and I still want to still see what has been historically the enhancement that we continue to grovel about with regards to what we've received from TechShare. So that plus the adjustment on this end will be I think makes a complete presentation.
So, Commissioner, and I think that was part of what COLI did is part of the texture market analysis across all of those portfolios, there were some enhancements made, and some were put in backlog. So, for instance, registration, a lot of their key activities were put in the backlog that didn't move forward. Juvenile, it's a mixture where some of the enhancements were made and some weren't. So, it's really dependent on that committee and how they vote, how the backlog moves forward. So, I know that's not it's going to depend on what's in backlog and what gets voted to do that. And then that's where you see the fluctuation sometimes in those costs, because you got to pay for that separately or added as part of that kind of backlog for the next upcoming resource sharing agreement.
But I think that is something that we can contact TechShare for the further information regarding enhancements in recent years, as well as any kind of projection for the future.
Yes, I think that's right. We can contact them and get whatever those enhancements were or will be.
I've had a little bit of trouble over the past 3 years with any prediction that the TechShare folks have made. They've been a little bit off, but I would just add that regarding the in-house model, it appears as though that Collin County made that decision not only based on the reducing expense, but also a bit of risk mitigation in that, at least for a prosecutor and indigent defense, there is a concern that TechShare will not be, an active partner and be able to continue to support those, I guess, in juvenile as well. So I think it's not just that Collin County was looking to save money, but rather it was a bit of risk mitigation in that they didn't believe that those products would be supported by TechShare for very long.
How do you know that?
I believe that was part of the decision. Ms. Kraft, did you get anything in that regard, or?
So it was more on the technical side. I think there were some cyber questions or concerns around kind of the .NET framework in the current version that they were at that time. So they did find some, vulnerabilities and compared pros and cons with maintenance. And I think from that perspective, they decided to go commercial off the shelf for their replacement.
Okay. So okay.
Because we can explore that a little bit too, if you'd like.
I mean, from the perspective of risk mitigation, I think that the overall strategy needs to be to move away from TechShare. It's a matter of when, not if. So this step would allow us to move away from TechShare in a very manageable way, and have a successful RFP and be able to make a better decision regarding what's the state of the art out there for these particular modules.
Yeah, I respect your opinion, but I think that we're still missing a little bit of information to make those decisions.
Okay.
Thank you so much.
Judge and Commissioners, before we end the discussion, I do want to point out that we need to make the decision. We have a drop dead on October 2nd because we have to provide 90-day notice plus the 10 to 12 weeks to stand it up internally. So we'll get that information as quickly as possible and then bring it back to you for the next Commissioners Court. But if it is the desire of the Commissioners Court to do this, we have to make a decision in one of our next two courts to do it. So just want to make sure everybody's aware of the timeline that we're operating under.
Yep. Thank you, Mr. Reed.
Yep. And yeah, we'll work with you all, commissioners, and make sure that we have your questions answered. And then when we can come back, we can do a proposal. This is apples to apples, and everybody understands. This is kind of just to get it out there to see what we were working with. So
thank you,
I appreciate your time. Thank you so much.
Thank you.
Thank you.
And thank you, Ms. Kraft.
Hope you feel better.
Okay, it being the case, I guess we're up to our consent agenda.
So
Yeah.
move without the personnel.
Move the consent agenda by Dr. Garcia without personnel.
Okay.
Second.
Got a second. Any unreadiness? All those in favor, let it be known by the usual sign of voting.
Aye.
Those who are opposed, same sign. Chairs in the affirmative. with regards to personnel that is before us. And the chair, I'll move.
I'll move it. I'll move personnel, including.
Commissioner Koch moves, chair seconds, personnel. Any unreadiness?
I would like to say that there's been a lot of work being done by HR and by various departments to positively impact the recruitment process and thus increasing the diversity. I still have not received that report of where some of those efforts have allowed our departments to be, so I will continue to abstain at this time.
And Commissioner Daniels just say pretty much what my feeling is. We still haven't seen the results. We know we're working. I'm very confident that every department is doing their best, but the numbers are still not showing it. So I will be voting no. Thank you, Mr. Chair.
Got a motion and a second with regards to personnel. Any other unreadiness? All in favor, let it be known by you, sound of voting.
Aye.
Aye. Those who are abstained?
Aye.
One, and,
I'll abstain.
okay, and one no.
One no. Yes, thank you, Commissioner.
Okay,
All right,
down to L.
that takes us to the bids. Is there a motion on the bids?
I'll move the bids. I'll move the bids.
Second.
I do want to ask Mr. Crawford, with regards, this, I see we're doing this in local, this is $2,600,000, and no real opportunities.
Correct. Absolutely no SB.
We keep using this dadgum code that doesn't allow any opportunity, and we just buy into it, Mr. Crawford.
Yes, sir. Greeting, commissioners. So what we try to do with the SBE department on each and every opportunity for supplier diversity, or what we call utilization, is examine the actual scope of work. We try to review the details to ensure that there's a true, in the sense of the word, commercially useful function, okay? And so we're gonna review each and every one of those opportunities and meet with the suppliers, in this case, the primes, to understand their supply chain, understand their operations, and then explore those opportunities. And so, to your point, the percentages that we have in regards to that particular opportunity did not increase, but we did explore several options with them to understand where there would be a true commercially useful function for that inclusion.
Yeah, okay.
So that's what we do on each and every one, and we will continue. I'm not satisfied with the percentage as well, but after reviewing their actual operations, I couldn't in good faith encourage them to incur additional cost or place someone in there that is not actually providing a useful function.
Okay. Okay, thank you, Mr. Crawford. Okay. Got a motion in a second.
All right, any unreadiness? All those in favor, signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we have the RFPs. Is there a motion on the RFPs?
So move.
Second.
All those in favor, signify, any unreadiness? All those in favor, signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we have court orders, keeping in mind that we've already passed some court orders today, so won't include those that have already been passed, which are 52, 63, 64, 65, 66, and 67. So we need a motion.
You gotta pull, but you gotta pull on two. Okay, go ahead. Okay.
So we need a motion for court orders M1 through addendum 69 that have not previously been pulling 2, 4, 13, 30, 31, 32, and 60. Oh, I'm sorry, 63 is already been voted on.
52 is that?
So pulling 2, 4, 13, 30, 31, 32 for separate votes.
Can you repeat it, Judge? 2, 4, 13, 30, 31, and 32?
2, 4, 13, 30, 31, 32. For separate votes.
So moved.
Second.
All right. Is there any discussion on these court orders before we vote on those that have not been pulled?
Yeah,
On
they're-
62, can we change that one from general fund to escrow as the funding source for the record? Was that
Sure.
one?
Sure.
change it from,
General fund to escrow fund?
Okay. Move agenda item number 62 to reflect the move from general fund to escrow.
Maker will
You were the
accept.
maker, and I
Yeah.
second, you're right.
You're right. That's all right. I'll say, I'll accept.
So we got that. All right, any other unreadiness before we vote on these?
Oh, I have some comments, Judge.
Yes.
First of all, I wanted to thank, Dallas County Health and Human Services, and of course, Mr. Reed and administration for including the ARP RISE 50 plus, in the agenda. I mean, this is a program in a partnership with Health and Human Services that provides transportation, Commissioner Price, to our seniors, to all those medical appointments and to all those needs that seniors have. It's a very good program in conjunction with WARP, and I really appreciate their partnership with Dallas County Health and Human Services and us, and thank you, Mr. Reed, again, for putting that, and Mr. Edwards for making it happen. What is the other? I wanted to mention also agenda item number 57. Let me just be sure, Judge, that I'm talking there. Yeah. Agenda item number 57. I saw Ms. Randolph, here earlier today about the fact that, we talk a lot about different ways of seeing and look what is the real need changes in the criminal justice system. And this item talks about this. It's a contract that will engage professional services to help ensure data sent to the Texas Commission of Jail Standards is valid and reliable. The project will reconcile all the data and meet with departments, stakeholders to better understand how data is generated in our courts and in the jail. So I think this is a good way to start, and I look forward to see this report. I want to thank Ms. Randolph for bringing that forward. And I think those were the other items that I wanted to check
Commissioner
on.
Garcia, and I appreciate us continuing. They have been on the ground. They have been very helpful with us in navigating all of the issues with regards to the criminal justice and the jail system, and to make sure that we're on par with our peer counties, as it appeared as though there was maybe some preferential treatment with regards to transfers that others were getting as opposed to us. And so this is a continuation of that relationship. And I appreciate staff for getting it out. On 23, I want to thank the Meadows Foundation. But more than anything, I want to thank Health and Human Services. Let me tell you something. They made Mr. Shovelmeyer and Dr. Wong, they made a tweak in the organization. And we had air conditioning in another sector of the department where the units were not being deployed. And they made a tweak, got all of those air conditioners, I think to the tune of about 400 of them, out and into homes, installed, got all of them out. And then it's been going on for the last several months, and I appreciate that. But the Meadows Foundation has come along, and they've also added some more air conditioning. But more than anything, it doesn't do any good if in fact, if the right people aren't pressing the buttons. And they moved it from, quote, CAP to weatherization where it should have been, and as a result, got the units deployed. And so I want to commend them and thank the Meadows Foundation for purchasing more units for our population, for our citizens.
I also wanted to, just following Commissioner Price, comments, the master facilities plan for the Dallas County Jail is also agenda item number 8. We've been talking for a long time about a data facility, about data way of doing business, and a data, jail at this point. I mean, this is just the beginning of the master facilities plan, but definitely we're gonna need everyone working together to be sure that the next facility actually meets the needs of the, criminal justice system in the future. So, thank you, Mr. Bazan and the Facilities Department Administration for bringing this forward. I know that it passed through the Facilities Committee already, but hey, here it is. The proof is in the pudding. We'll see what the result will be, and definitely, this is another example of why we need money to operate Dallas County. Thank you.
I have a couple of questions also. Yes, we do need money to operate Dallas County.
Well, just
but numbers
thought it was a cute
37
point.
and 38, maybe Omar Rodriguez could help with an explanation. They both deal with contracts with Tyler Technologies, and I just wanted to verify that number 35 is saying that the contract to provide the Dallas County courts and the JP systems are going to be delayed 1 year. Is that correct?
Yeah, Commissioner, it's the criminal side is going to be delayed for 1 year from May of 2022.
To May of 2023. Okay. The second part of that is then in addition, Dallas County is going to be contracting with Cooper and Ancobia to augment the staff so that in fact those two contracts can be completed by May of 2023. Is that correct?
That is also correct, yes.
So that from the proposal and the contract that was signed with Tyler Technology has a year delay and $1 million higher price tag, basically.
For criminal side, yes, and then JP will be going live as scheduled.
And when is that?
October 31st.
Of 2022? Okay, thank you very much. A second clarification, I think I saw Mr. Scarpello, did you come in?
Yeah.
On number 69, it's a request for Elections Department for additional funding of about $1.1 million. And are these all, some of the items included here look like they are items that would already be covered. The legal notice of election, just going down the list, so are these increased on each of those items?
No, good afternoon. So in this item, it has a listing of basically a lot of things that we're prepaying for the November election. So they're in next year's budget, but we need to pay for them now. And so that's a large chunk.
But isn't that something that would have been included in last year's budget then?
Yes, but there are some reasons that we have shortfalls. Number one, the May 7th election was budgeted as a smaller election, but it was then expanded by the state to be a countywide election. And then the May 24th election was also budgeted to be just a runoff election, small election, and then that was expanded to be a countywide election also. And so we ran short. And so we're coming back
How
for
can
some
you
money.
have a less than county run election for any election though?
Because normally the May 7th election would be a joint election. paid for almost entirely by the entities, but instead there were 2 constitutional amendments added by the state. So then the county took, it became countywide, and then the county paid for a large share of that election rather than the participants paying for all of it.
And what was the difference then in the amount budgeted and the amount that ended up, the actual cost?
I don't have those figures in front of me right now, but I can provide those to you.
Because it just, when I went through this item by item, it just seemed that there were a number of items that would have already been, included, sample ballots. That's something that's already included in the budget, right? So why would there be an additional cost to it?
It's mostly because we've run into a shortfall because of those 2 added expenses for that May 7th and May 24th election, unexpected expenses.
Okay, I'd appreciate that, what that difference is.
Sure, we can provide that.
Thank you very much.
Mm-hmm.
And while you're up there, this repurposing those 3 positions, I know that HR has bought into it, but no more employees. An HR generalist, community outreach coordinator, man, both of those are $80,000 job. Why, with the number of employees, why do we have an HR generalist? And I didn't see Mr.
There he is. He's behind.
Wilson? Yeah. How do we, that's why HR generalist just in elections.
So when we did a reclassification or reorganization last year, and we purposely did that in phases, and we did the majority last year, but we always knew that in our admin division, we tucked HR, fiscal, et cetera, all under that division. And we knew that going in, the plan was to evaluate that, work with the auditor's office, work with HR. And so we've done that, and what we've discovered is that we've got a little bit too much tucked into that, under that admin group. And so we've broke HR and fiscal apart, and under HR, there's been an expansion of the duties. So it's HR and records. And so as you know, we've had an explosion of records requests coming in from all over the place, all around the state, including our county. We're also in 4 lawsuits. We're also, we're under state audit. And so we have a huge demand for a records coordinator. So it's an HR and records coordinator. Also tucked under that new group is also safety coordination. Since the shooting in Uvalde, we've got a new need now to really spend a lot of our resources planning for safety. And so we're also, that group is, so it's an expansion of the role of that particular person, the HR and records group.
Community outreach coordinator means what? So I read it and okay. I read it. They repurposed to community outreach coordinator, focus on community outreach, city relations, school district relations.
Sure. So for all 3 of these positions, they're all reclassifications. So we're taking clerk 2 positions and moving them to higher level positions so we can have more success in hiring. And this particular position that you're the community outreach, this is an expansion of our outreach. Right now we have a voter registration outreach coordinator, but we don't spend enough time in the community educating them about the election process, et cetera, and activating those groups out in the community. And so that particular position is a higher level position that will be focused on that, not only that community outreach, but also spending a lot of time, for instance, with our cities and our school districts, because what we've found is that some of the city secretaries or the clerks and things, they need a little bit more of our attention, and so we're trying to give them better service by having this person dedicated to working with them.
Yeah, and that happened during the last election when several of the city secretaries, were not aware of all the language that was in the papers they had to sign, and there was a miscommunication there that delayed the process for a few days.
That's correct.
Definitely, yeah. Thank you, Mr. Scarpel.
So we're talking, going from grade 6 clerks to grade H's. And
We'll see how it produces then.
Well, hey, I think, I appreciate the fact they're looking into it and, it's coming to a big election. We better be prepared, and I think this is a good step forward.
well, but first of all, you got position numbers and then reclassification, so that means that you usually you got someone incumbent in that position. And how do you take a position from a grade 6 to a grade H?
They're vacant, Commissioner.
They are vacant?
Yeah.
Okay. You just said repurposing and you got position numbers, okay.
Is that,
So that-
I mean, isn't,
okay.
I thought that there was a restriction on how many,
Steps.
how
you
many
could-
steps
you could
of
move
an
up.
increase you could take.
Yeah. Then
These are vacant positions though, so they're not filled, so they're actually just reclassing the positions, not people in the position.
Okay.
still.
All right, any other comments before we vote on these? All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. First
Agenda item
order
number
in
2.
front of us is court order number 2. Your motion on 2.
I'll move 2 to get it up.
Elected official salaries.
I thought that was pulled for a separate vote, is that it?
Vote for separate vote.
Yeah.
Move approval.
So I think Commissioner Price moved, Commissioner Garcia seconded.
Yeah, because this is
And
just
this is
the
only
posting of
because-
it, right?
Dr. Watkins, can you put in the record what does this mean? Because I probably not the right person to move this. I haven't got a salary increase since I got elected. So, I mean, can you please put the context of why this item is here?
So, it has to be part of the budget, and we bring it before you because we have to post their salaries in the paper. And so we can't post them without you guys approving it prior to doing that. So this is the process that we have in place prior to adoption of the budget, which we have scheduled for September 6th.
Sounds good. Okay, so it's a requirement for us to be able to move the budget forward. That's what this has to be posted.
Yes.
Okay, Commissioner Price
And this-
moved, and I second.
And this is a 3% increase effective January of 2023.
It is
For elected
3%.
For PCE COLA.
Right.
Oh, then I will not, I would not second.
Second. It's something that's required to be done,
Yes,
regardless of how the final vote comes.
Correct.
Yes, we do.
So I'll second if a second is required.
it is. Okay, Judge, you can call.
All right, any further discussion? All those in favor signify by saying aye.
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 Any opposed?
No.
Any abstentions? And I abstain.
I vote no also.
2, 2, 1.
2,
2,
2,
1.
and 1.
Okay. I guess
Did it
that
pass?
motion fails on the 2.
No.
Hold on.
No, you abstain.
The judge abstained.
I know, but I think it fails
Yeah.
if you don't get an affirmative.
I'm no. No.
So
no,
two
yeah,
no's
2, 2,
and
1.
2, 2, 2.
Oh, okay, 2 to
Yeah.
1.
Yeah,
2,
Judge.
2, 1.
That, yeah, so then.
I'm sorry,
therefore, the motion
can you
fails.
clarify how the vote was again, please?
Yeah, so we have 2 noes, 2 yeses, and an abstention.
Who was the abstention?
I'm an abstention.
Okay, then it did not pass. And you do need to be aware that you are required by law to post in the newspaper prior to the budget, per the statute, what the elected salaries are gonna be for those elected officials who are set forth in the order.
I thought that this did not include an increase in salary, Dr. Watkins, that this is only the numbers that they're, are standard for all the commissioners and the judge.
So this is a 3% COLA PCE for January, effective January. Recommended.
Recommend.
It's not included yet.
Okay.
It's recommended.
It's recommended but not included. Okay. Well, I'm gonna vote against this.
Given that, are you fine to abstain, Commissioner Garcia, or do you want to stay where you are?
Oh, I stay where I am.
All
it didn't say that it had the increase recommended. And I don't know how is it because I don't get a salary increase.
I may come back to this.
So it's gonna
All
have
right. Next before us is.
So it fails, right?
Yeah, it currently fails.
Yeah, Judge and Commissioners, we have to pass the court order. It doesn't have to say 3%.
There you
We
go.
have to pass a court order to post the salary so that the budget stays on
If
schedule.
it doesn't have the 3%, I will abstain. But if it does, I have to vote no. Correct.
Yeah, if there, yes.
Correct.
The Commissioners Court would need to amend the court order, bring the vote back up, amend the court order to whatever is acceptable to the majority. But the court order has to pass for the budget to stay on time.
Move it to stay at the same.
My only concern is that they can grieve it, the elected officials. And so then that pushes our schedule back as far as adopting the budget.
But, and just keeping in mind, if you pass 3% or 5%, they could grieve that too.
Yes, they
Grieving.
can.
Okay, we're gonna come back to that perhaps. Next, we have court order number 4. Is there a motion on court order number 4?
I move court order number 4. They've already performed. This is just about paying them.
Yeah. And I just had a question regarding, how did we get here? I know that, we've been.
Well, I need a second, but court order 4 is.
Second for discussion, and we need to pay them, so I second.
Right.
Yeah.
Just want an explanation of how we got here, because I know that, spoken about the kind of exorbitant amount of security folks at North Dallas, particularly now that, most of the COVID line management has died down. Here we are with this significant overrun, so I just wanted to get an idea of how we got here and how we're not going to do this again.
What happened? Why is there the increase? What happened?
Budget received it based on invoices needed to be paid. So we're briefing it to get the invoices paid.
Yeah, it's just about, that's,
I know the contract is over soon, correct?
yeah, it's just about, it's just.
So this cost was expected.
No, it wasn't budgeted.
But we owe it.
We had a lot
already
of
work it.
activity at, particularly some of our newer courthouses. I think if you guys remember, in Oak Cliff, we had a number of incidents, so we increased security there. South Dallas Government Center, we had a lot of incidents. We increased security there. So all during the year, we've had incidents around our buildings which required us to increase security. Of course, at $19 an hour or whatever it is, it gets expensive. And remember, this security has been 24 hours. I think the incidents we had at Oak Cliff were shootings that occurred in the evening. The incidents we had at South Dallas Government Center were people driving through parking lots and speeding and racing in the parking lots and damaging our buildings.
So we owe this money.
Oh, yeah.
That's what I said.
So I'm seconding.
A microphone. Thanks.
We've reduced the number from 185 at the peak of COVID, which is really meant to focus on the distancing and the transition and getting folks in and out the buildings. You remember back, the lines were out the door. You needed those folks. So I think at its peak, and Chief Dos Santos can answer specifics, but you had 185. That's down to under 100 right now. And we're continuing to look just to see where we can actually reduce that.
So, I do want to have an idea of where steady state, what does that look like? Is that, still close to 100, or are we looking at 20?
You're going through a transition right now to a new vendor, and I think some of the members are aware that hasn't exactly been a perfect transition too. So right now we're recommending keeping the same number while we continue to look to see if the vendor, which is supposed to be a higher quality, can perform with less personnel.
Okay.
Regarding the costs, like Mr. Martin said, there was a lot of fluctuation. There was pushing additional personnel. If you had people outside the building at Oak Cliff one day, you needed to have more people on site. Right. So that hopefully explains it. Okay.
With that, we hope that the new vendor, can comply with the needs. Thank you, Mr. Bazan. Thank you, Fire Marshal.
Okay.
All the questions,
Got a
Judge.
motion in a second.
All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we go to court order 30.
And 13.
13, beg your pardon.
You have a speaker on item number 13 as
Okay.
well.
Will the bailiff please read the rules of decorum for our public speaker?
All Commissioner Court attendees are hereby advised that this meeting is conducted in accordance with the provision of the Dallas County Code, Section 74-71. Visitors and registered speakers are to preserve order and decorum at all times. Personal, profane, or slanderous remarks are not appropriate and will not be allowed at any time during this public meeting. And in all applause is to be kept brief in observance of time constraint. Disruptive visitors and or registered speakers may be removed and are subject to the penalties provided in the State of Texas Penal Code, Sections 38.13, 42.01, and 42.05. Registered individual speakers are limited to a maximum of 3 minutes, and the maximum discussion on any one topic is limited to 30 minutes. Thank you.
All right, and our speaker on this is Diane Tassan.
Oh, do we need a motion in a second to open the, do we need to move it to?
Oh, yeah, good point. I don't think we have moved it. Let's, somebody move in second, 13, please, so she can speak to it.
I'll move it.
I second.
Okay, go ahead, ma'am.
Thank
And
you.
You'll have up here somewhere's a clock, I think, and it'll say 3 minutes, and as you get, to the end of that, just finish your sentence when you get to the end.
Thank you. My name is Diane Tassian. I reside at 3831 Turtle Creek Boulevard. As president of League of Women Voters of Dallas, I'm here to support this item. Specifically, the Vote Anywhere campaign and its timing of late September is just one example of some issues and opportunities for public relations. We are a nonpartisan grassroots organization founded to empower voters and defend democracy. Since 1938, League Dallas has advanced our mission by registering voters, hosting candidate forums, and publishing our nonpartisan voters guide. For 2 decades, our League has supported increased efforts to publicize locations in advance of early voting and election day. We developed this position in 2002, long before Dallas County vote centers were approved by the Secretary of State in 2019. A little history. The 2018 midterm elections occurred before vote centers were approved for Dallas County. Some locations have moved during the pandemic to locations large enough to handle physical distancing. Some temporary branch locations became regular vote centers when temporary branch locations were eliminated by the state legislature. The Dallas College campuses are an example of this change. There are differences in early voting and election day locations. An emerging issue is is finding vote centers placed in large schools. I'm not going to mention Uvalde. Most people don't pay attention to elections until it's time to vote, so it can be confusing trying to find a place to vote. Many still don't know the added benefits of vote centers. 3 basic points need to be broadcast far and wide. 1, vote centers are available across the county and voters can vote at any of them. 2, how to find vote centers. And 3, when the location finders for finding vote centers will become active. During the last election, Dallas County Elections Department added a Where to Vote application that is viewable on your phone. This is a great improvement over the map images on the website or the vote center listing. It would be great if the early voting locations could go live when the Vote Anywhere campaign starts. This allows volunteers who are out registering and educating voters to demonstrate how easy it is to find a vote center. It would also be helpful to have some videos on the Dallas
Sorry,
County
Ms.
Elections
Chessie.
website.
You're out of time, but thank you so much.
Thank you.
Thank you, Diane.
Any unreadiness before we vote on this item?
Oh,
I have a couple of questions. How is it going to be paid for? Because it looks like in one financial impact, it has it's being paid for through ARPA, and then the recommendation has it Department's General Fund.
So it was originally briefed as coming out of the department's general fund. Doing a closer look, they just don't have the funding to pay for it. We do have some flexibility in specifically one category of the American Rescue Plan that this could fit under, which is the one we put it under. That category is, it has enough funding to fit this within it, but not much on top of doing that. So there is a way to fund it using the American Rescue Plan.
Okay, so then the recommendation item should reflect ARPA funds?
Yes, it's my apologies for not correcting that on the
That's all.
addendum.
I just had a quick question too on, we spend significant amounts of money on media in a variety of ways, and I most definitely see the value in reaching out into the community and making sure that we educate the community, particularly on election items. Has there ever been an attempt to evaluate if it makes a difference if we do this?
So we do get regular reporting metrics from ABI. They give us number of impressions. They give us reports on both the TV and the radio outreach that they've been able to generate. They give us those reports on a weekly basis every Thursday. Apologies, not every Tuesday. Every Thursday. We certainly can pass those along to the Commissioner's Court every Thursday if you'd like. It's never my intention to overwhelm y'all with information. Do a comprehensive end of campaign report for all of them that we do have on file for all of the reports. It shows impressions, it shows outreach. Happy to share those with the Commissioner's Court as they come through.
That talks about their performance of complying with the contract.
Correct.
Do we have any assessment of, does it make a difference if we do a media outreach?
Definitely.
Yeah, I would say anecdotally, yes. I don't know that on the media campaigns that we have done so far that there is a way to measure its effectiveness other than impressions.
Well, we've been able to measure, and again, back to what I was saying to Dr. Wong this morning with regards to vaccination site. My staff basically texted me and said the reason is we deploy them before we go into an area. And then as a result, we get inundated. We can tell. And these are some of the areas that historically, let me just say, we've kind of overlooked. They've been deemed to be difficult areas to reach. But we've been able to do that primarily because we deploy them first and then we come in secondly.
And to the point Commissioner Price is making, Commissioner Daniels, sometimes you don't really know, how much of a difference is going to be until you see the results. Sometimes, and I know ABI has been good reporting, what are the impressions, and obviously this is going to be in English and Spanish, Vietnamese, which is good. I'm very glad that I finally saw it without having to ask for it. Thank you, Diane, for being here, and thank you, Mr. Scarpello. All we can do is, do the best we can in trying to reach. In the last election, one of the issues where this really made a difference, Commissioner Price, and I think you know this also, Commissioner Daniels, was with the early voting. All the seniors that got confused, and I know we all got those emails because I remember seeing, trying to separate them. So for no conflict of interest, but I mean, with that being said, we saw firsthand that the calls that they did to a lot of the seniors made a difference in some of the cases. Other ones, I mean, Mr. Scarpello, he had to send some people, directly to, teach them how to do it.
That was the
So-
work of the Dallas County elections to follow up in particular on who
Correct.
received mail-in ballots. So, but what I'm asking for here is, I understand that we can count, yes, they did, hit the billboards and, did all the texting and all that kind of stuff, but does it make a difference in the preparedness of voters? And I'm not sure exactly, what's the metric and that kind of thing, because on the immunizations, I mean, you can count them up, how many people were immunized. And it's, maybe it's a difficult question, but just $606,000, is this money that is well spent, I guess is my question.
We'll get with elections and with ABI to see if we can come up with a way to measure the effectiveness of the campaign and bring that back to the Commissioner's Court.
And you got,
We were very definitive when we met with elections and Mr. Eno about indicators. First of all, making sure we're fish where they're fish. And so we talked about Nielsen and ratings, et cetera. And the court, those of us who been in this court remember, this was the same thing I did. This is not our first rodeo here, Jim. We did this the last time. Yeah, I asked for that same kind of information. And then number two, there were some other innovative outreach in the deal, and I just want elections and Mr. Eno, I'm all in. So I've talked with.
But I'd like to see what those were,
and
and to see if we can, how do we know that it's money well spent, is my question.
And that brings us to a question I need to figure out what we're voting on today. So in the original proposal, you had these innovative, whatever they are, these things on the intersections. And then that was taken out because Commissioner Price had some concern. Now, he's all back in, but I think what we have before us today does not include that.
Correct.
It includes everything but that.
Correct.
Do we want to include that? Do we want to bring that back? What does the court want to do?
When we look at the overall package, it's my understanding that was very definitive, and it's $50,000 total.
It was $130,000.
Was it 130?
And it was.
But I thought they were
make sure that it's nonpartisan and reaches all areas of the county.
To do that countywide, it was going to cost $130,000. It was removed.
Okay.
Consultation with the Commissioner's Court.
Okay.
And some safety issues.
And some safety issues, yes.
Okay.
That brought some liability as well.
Yes.
So the court's aware of it and they want to not do it.
Say that one more time.
It's not.
Just want to. So the members are aware of it, and I think what I'm hearing from the body is there's not a desire to do that. Okay. So then before us is the $606,000 and change thing with everything in it but this, whatever the thing was, the intersection thing.
Correct.
And I have two questions. In the briefing, we have a mention of mail-in ballot, but then in the messaging in the contract, there's nothing about mail-in ballots. I know that was a significant concern during the primary, folks having to put the either Social Security or license. So let's go with that.
Yeah. So the reference to the mail-in ballots was just to make the case for confusion in voting in general. This marketing campaign is exclusively to market countywide voting in Dallas County. In the scope that we received from ABI, the messaging is very simple. You can vote anywhere, no matter what district you live in. Registering to vote is easy. And then once you register, you even have access to a sample ballot that makes voting easy. and then explaining when early voting is and when election day voting is.
Okay.
Those are the 4 messages.
And then I guess, the second question along with that, I mean, you've read all that's in the contract, but in the operational impact, it states, and end with encouraging voters to cast their ballot during early voting on election day. And of course, we cannot encourage folks to vote. We can tell them, you know, where the opportunities are, but we're not legally allowed to tell people or encourage people to vote.
Correct.
All right, is there any further unreadiness on this? All right, any other comments? All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next is 30.
Yeah, I wanted to,
You just wanted to pull it for 2 weeks?
oh no, I just got a question.
Okay.
But let's-
Somebody want to?
Move 30.
Second.
30, move 30, I'm sorry.
This is another one of those, well, I mean, we haven't had this too many times, but the dollar amount of this contract just happens to be right under $50,000 where we'd have to go to a procurement process. So just kind of want to know, you know, if this is on the up and up, or are we going to end up spending $100,000, you know, down the road once we get this contract in place? Because, you know, that seems to be kind of a improper abridgment of the procurement process. Do we have Dr. Wong? We do,
Dr. Wong?
but he's asleep.
So you want to, if you heard that, it's always a red flag to us when we see $49,900 or $800 on a contract. Can you tell us about this contract, and is it really going to be $49,000, or are we going to be adding to it later?
Well, I mean, again, I in terms of the amount, I don't know exactly how that particular figure came out. It is a needed service for the CQM. Here, I've got a little.
Who on HHS was working to negotiate the contract?
Let's see, I have a little bit on this. The rates increased to 200 per hour, is previously 150 per hour. But the HRSA has approved this technical assistance. We've, you know, received a lot of training and support to become, you know, we actually were awarded recognition for our quality improvement efforts by HRSA. And so again, I think that I am seeing that some of the rates per hour did increase to 200 per hour from 150. But in terms of the details of getting it.
So this is who HRSA wants us to use, basically.
Yeah, HRSA, it's a HRSA thing, and we're actually have received recognition for our quality improvement efforts in this area, so it's a HRSA recommendation.
Okay.
The numbers picked, you're right, that were fairly convenient.
Yeah, it's.
Because it was
Okay,
249 hours.
Yeah, and I know when.
And another hour obviously would have.
Yeah, this does not look good.
Why wouldn't you say 250 hours? Well, because that's 5,000,
Yeah.
50,000.
Yeah.
All right, any further in readiness? All those in favor signify by saying aye.
Aye.
Any opposed?
I abstain.
Okay. Then passes 4 with 1 abstention. And next we have number 31.
I'll move 31. Move 31.
Second.
Okay. All right, any unreadiness? All those in favor signify by saying aye.
Aye.
All right.
All those opposed?
Oh, all those opposed?
No.
Okay.
And
32.
32.
I move 32.
Second.
Okay. All those in favor signify by saying aye.
Aye.
Any opposed?
No.
Okay. And next we have number 63.
I think we're done. That was it.
Okay, yeah, we already did that. Okay, let's go back to court order number 2.
I move
Baker needs to reopen, right?
I move, court order number 2 with, the 3% out.
Second.
Okay, is there any discussion or willingness from other court members to, discuss this or propose any type of a salary increase or COLA adjustment for elected officials?
0%.
He's for 0, you're for
I
0.
always
Okay.
voted no on any kind of salary increase. I was hoping that this item will come out without the increase, so we could post it, but it is what it is. I have never taken a salary increase since I got elected, and you know, if it wasn't without the increase, I would have voted for the purpose of, you know, posting, but it is in the budget, and I won't be able to support it. Thank you, Judge. Thank you, colleague.
You have to amend it because something need to be voted on today.
I did amend it.
Oh, okay.
That's what I said, with 0.
You said 0%?
I did.
Okay, I didn't hear you, I'm sorry.
I didn't hear you.
Yeah, that's the only reason to bring it back. I mean,
It has to be amended because we do have to post something in the paper, whether it's 0 or.
On the
3
record,
or-
Commissioner.
Yeah, I said, yeah.
So this is for the 26 people. How many people are included here?
All the electeds.
Elected, all the elected.
So the county judge, sheriff, county commissioners, county clerk, county treasurer, district clerk, tax assessor, justice of the peace, and constables.
Because I think it's 26 in the end. So it's not just us who are on this list.
No,
No.
no, it's elected officials.
To clarify, whether you give it an increase or not, you are required to give notice to those elected officials of the salary you're proposing. The publication in the newspaper is if you increase it, but it doesn't change the fact that you have to give notice to the elected officials when you set their salary, so they have a right to exercise the grievance procedure if they choose to.
Right.
All right, any further discussion?
So what is being voted on at the moment?
0.
0% COLA
Increase.
for
So it's been
elected
amended.
officials.
Yes.
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 All those in favor signify by saying aye.
Aye.
Any opposed?
Aye.
Okay, I got 1 for and 1 against on that.
Well, it doesn't, it
We
has,
have abstentions. What do we got? What did I miss? The other 2 didn't vote?
yeah, because it has 0. It's been amended to just for posting, Judge.
Yeah, we have to, but we
We
have
have
to
to vote,
we have to
though.
vote we have to
Yes.
vote.
Correct.
You have to give notice to the employees.
Correct.
Yeah. So we're at 1 and 3 abstentions.
3 abstentions. I guess that fails too.
That fails, you have not set their salaries.
All right, Commissioner Garcia, do you want to vote for 0? Since that, if somebody joins me in abstaining, they can have a 3% COLA. If somebody will vote no, or yes rather, then they'll get 0, but somebody needs to vote.
You could be the one that votes though, right? I mean,
I've abstained.
I love this.
I moved it, but, you know, while I'm moving, you can't move it and abstain. Can't move it and abstain, too.
So we've got 2 for it. Dr. Garcia, do you just want to vote in some way, either abstain or vote yes or no?
You can vote it too, Judge.
No, everyone's voted but you. I'm just, do you want to?
No, I vote yes, just for the purpose of
Yes.
putting it in the newspaper.
Okay, so that is 3 yeses, 1 no, and 1 abstention.
For 0.
The no was Commissioner, I can't remember who the no was. Daniel, yeah, Commissioner Daniel. Okay. All right, that takes us through our court orders.
I have one that I want to pull. Item 3 under travel. We need to talk to the judge for more information.
Okay, talk to me about something.
Not you, Judge Jenkins.
Oh, some judge?
Yes.
Some judge, okay, I got you.
Thank you, Judge. Thank you, Dr. Watkins.
All right, so
So
we
that was
got,
on-
That was item 3 on the travel miscellaneous
okay.
brief.
okay. So we still got some speakers. Let's see, we have Yolanda Williams. Is Yolanda Williams? Is Yolanda Williams? Did Miss Williams make it? Online maybe? No? Okay. So that concludes our speakers. Next up is our closed session. We'll begin closed session momentarily to consider items under Chapter 551 of the Government Code as previously posted. Any action as a result of the closed session will take place in the subsequent open session, and we'll begin that closed session in a minute. Thanks. Thank you, great. Oh, okay, still waiting on the clerk.
Okay.
Interesting. He thought I didn't like it.
Let's check it out again to make sure. So I don't know what was going on with the sunspots there. Did you want to finish this up?
Oh, I agree with you.
Do we have a,
But I mean,
Judge, did you want to finish, oh, are we waiting on something?
You know that we do. But I have to tell you, I mean, these projects, these change. Of Lamar and, you know, that's what the judge now looks at. And at the beginning,
First was representing the FOPI program. There really wasn't apartments quite yet, so this was probably like 07,
yeah, probably a little earlier than that.
Yeah, it wasn't great.
No, I mean, it started changing probably.
It's actually recorded.
Yeah.
Judge, Commissioners, it's actually recorded, so we don't really need the clerks here to just close it out. Yeah.
No action necessary as per the closed session, court stands adjourned.
Oh, I could have closed it. Oh, well.